Good evening, Chair. Calls to order Board of Health update. Board of Health update, spring 2023. Council, it's my pleasure to welcome Ms. Marcy Austin, our health officer, here this evening, whenever you're ready.
Thank you, Mr. Vincenti. Good evening, everyone. Welcome.
Just bring that mic closer to you.
I know. So let's go. So tonight's agenda is we're going over the health equity report. We're going to do program updates. Is that better? I'm going to talk about the partnership programs with University of Maryland Upper Chesapeake Health. And we're going to have special reports from our behavioral health and environmental health bureaus. According to the CDC, health equity is achieved when every person has the opportunity to attain their full health potential, and no one is at a disadvantage to achieve the potential because of social position or other socially determined circumstances. Health inequities are reflected in differences in length of life, quality of life, rates of disease, disability, and death, severity and disease, and access to treatment. The Health Department Population Health Unit has successfully completed and presented the first draft of the 2023 Harford County Health Equity Report to major stakeholders. A copy of that is in your folder. Thank you to Zil Rival, our epidemiologist, and Zach Makis, our health policy analyst, for a great report and for their presentations at many of our partnership meetings. Throughout Harford County, disparities and inequities exist in every realm of health. The Health Department is committed to improving health equity in the community. The Health Department will continue to prioritize increasing the standardization of public health messaging through community health outreach workers and increasing the cultural competency of our staff, including an all-staff training to be held this Thursday. The training will be the beginning of our development of a unified health promotion, education, and communications strategy. Now we have some program updates. The Health Department Minority Health Program's second annual We Matter Youth Symposium for middle and high school young men will be held on Saturday, May 20th from 4:30 to 9 p.m. at Aberdeen Festival Park. The afternoon will be filled with food, games, prizes, special guest speakers, a panel discussion, and a next steps session to empower the young men with ideas of what they can do after graduation. Thank you to Felicia Hopkins and Michelle Peterson for their continued efforts in support of our minority health community. So every year, Medicaid enrollees are required to renew and verify that all of their information is correct. For many Medicaid enrollees who were due for renewal in March of 2020, coverage was automatically extended through April 30th, 2023 because of the pandemic. Now that the extension ended, many Medicaid enrollees are not realizing that they must once again renew their coverage every year. Because of this, our staff is working diligently to reach out to folks by phone and letters to inform them that they need to renew their coverage. Many folks have been unreachable due to change in address or phone number, so we anticipate a lot of people will lose coverage temporarily. We encourage Medicaid enrollees who may have lost coverage to reach out to our MCHIP program, and our staff will assist them with their renewal. Thank you to our amazing MCHIP staff, led by Karen Platt, for their tireless efforts in assuring people have their Medicaid coverage. This is the Happy Healthy Homes is the health department program that helps seniors age comfortably in their own homes. Funding from HUD, which is the Housing and Urban Development, provides minor or moderate to moderate home modifications to help promote aging in place, reduce fall risk, and alleviate cost burden for seniors. The Healthy Happy Homes program has been very successful since beginning last fall. This is a 3-year, $1 million grant. The program statistics so far include the health department has received 43 referrals, 5 projects have been completed, 27 projects are in progress, and 11 were not eligible.
Marcy.
Yes.
I never thought I would say this, but can you push that mic back
I'm
just a little
talking
bit?
too loud?
That's plenty right
Somebody
there.
help me. Okay, now?
Yes.
All right, here we go. So, next we're going to talk about Care Coordination Plus program. So I was sent an interesting story by Kim Prout, the Health Department's Director of Care Coordination Plus, about how a nurse case manager all the way in Anchorage, Alaska, reached out to Kim all the way over here in Harford County. What could have ended with, sorry, you have the wrong number, ended instead with a client receiving an entire array of services in Harford County. The Health Department's Care Coordination Plus program received a call from a nurse case manager from Province Hospital in Anchorage, Alaska. As the Bureau Director for Care Coordination, Kim was speaking to the nurse and was just about to tell her that she had the wrong number when the nurse further explained the situation. The nurse had a patient she was working with to prepare her for discharge. Is that noise coming from me?
Yes, ma'am.
What am I doing?
You're doing just fine.
Okay. All right, so they're preparing for discharge. The patient was in her early 20s, homeless, and had lost her job. The patient's father lives in Bel Air and has offered her to come to Maryland and live with him. The nurse case manager started doing some research and found the number for the Care Coordination Plus program here at the Health Department. The client has since moved to Bel Air and was contacted by Kim. Kim referred her to MCHIP to apply for medical assistance and the Administrative Care Coordination Unit for health choice education, including finding physicians and transportation to her medical appointments. I want to thank Kim for her extraordinary case management and care coordination skills and knowledge of services in our county. Kim is here today. This is only one example of the work the Care Coordination Bureau does daily to connect people with the services they need, including referrals to our own services and referrals to community services as well. Kim also oversees the Healthy Happy Homes project that I just spoke about. Our dental program. So the Health Department dental program strives to improve the oral health of children and pregnant women in Harford County through both restorative and preventive care. The Health Department's two clinics, the original clinic in Edgewood, that we like to call the Dion Clinic, because he was very supportive when we were building that, and our newer clinic at our 1 North Main Family Health Center in Bel Air, serve children ages 1 to 20 who are enrolled in the Maryland Children's Health Program. The clinics also serve pregnant women enrolled in the Medical Assistance Program. The dental clinic has expanded services to include adult Maryland Medicaid participants who, as of January 1st, 2023, gained access to comprehensive dental coverage. To date, the clinic has provided care to 122 adults who were not previously eligible. Accepting adult Medicaid patients is a significant expansion to our existing services. Therefore, we are in search of a second general dentist to assist with the demand of this adult dental Medicaid expansion. The Health Department also has 2 pediatric dentists on staff. Thank you to Megan Jersa and Sarah Moore for their dedication to the dental program. It is near and dear to my heart. The Health Department has had a long-standing partnership with Upper Chesapeake Health, and the following 3 slides will give a brief overview of some of our shared programs. The Health Department's cancer program offers no-cost cancer screenings to eligible Maryland residents for breast, cervical, colorectal, and lung cancer. The program also assists with case management and provides education to patients. The breast, cervical, and lung cancer screening programs are conducted and supported by Upper Chesapeake staff. Monthly after-hours breast and cervical cancer screening clinics are held at the Kaufman Cancer Center. Screening is an important tool that can save lives. The Health Department and Upper Chesapeake are also working together to improve diabetes cases in the county by expanding the diabetes prevention program called Prevent T2 diabetes classes. The 12-month in-person and virtual evidence-based program can help reduce one's risk of developing diabetes. Trainers focus on skills to lose weight and eat better, become more physically active, manage stress, and build new habits. Upper Chesapeake trained 2 of our staff members to become trainers of the diabetes prevention program. Thank you to Kristen Perry, our nutritionist, and Alejandro Fuezo, our community outreach worker for the Latino population, who have gotten rave reviews for the classes they have taught so far. And finally, I wanted to highlight a recent partnership with Upper Chesapeake. The Health Department and Upper Chesapeake Health have partnered to improve health access to the county. The Health Department's Woodbridge Clinic in Edgewood will share their clinic space with Upper Chesapeake as they provide episodic care to individuals 18 and above who are insured or uninsured, and will assist in connecting them to primary care. The Health Department is assisting in providing care coordination and nutrition consultation. This clinic will provide a nice cross-referral system to the Health Department's clinical services and further strengthens our partnership with Upper Chesapeake. In addition, we are planning a ribbon cutting to officially introduce the clinic on June 5th, and you all will be invited. So, for our special reports, I would like to introduce Andrea Pappas, you guys can come up, Director of Behavioral Health, and Dr. Julie Stancliffe, Medical Director of Behavioral Health. They are a forward-thinking powerhouse duo who are always looking for innovative ways to serve the ever-increasing complex needs of our behavioral health clients. They lead a large team of counselors who are working with intense and complicated cases themselves. So Andrea and Dr. Stancliffe are always thinking of ways to boost morale with theme days and staff lunches. So I'd like to introduce Andrea. I think you're going first.
Great. Thank you, Marcy. So the Behavioral Health Bureau is comprised of 3 different units: our Local Addictions Authority, our Division of Behavioral Health for Adults, and our Division of Behavioral Health for Youth and Adolescents. For our Division of Behavioral Health Adults, we have an outpatient clinic as well as an intensive outpatient program. It includes group therapy, individual therapy, medication management, as well as family sessions. For our Division of Behavioral Health for Youth and Adolescents, that includes individual counseling, group counseling, medication management, and family therapy as well.
Tell me when to switch.
Oh,
now.
you can start.
Okay.
So for our Division of Youth and Adolescents, just a couple statistics. In FY22, we served 125 youth and adolescents in our programs. And so far in FY23, we've already served 154, demonstrating an increase of those that we've served thus far. Besides that increase in the volume, we've also seen an increase in the complexity of these cases and how much more intense and involved, complicated these presentations have been over the past year. So compounding this, the shortage of youth and adolescent providers at outpatient and inpatient levels and the wait list of current providers, we've definitely been experiencing a surge as well as facing our own barriers. So for our Behavioral Health Adults Clinic, in calendar year 2020, Harford County saw 101 opioid-related deaths and saw an increase of 110 opioid-related deaths in calendar year 2021. In calendar year 2022, we did see a decrease to 85 opioid-related deaths. And while this was encouraging, our team wanted to explore more innovative and less invasive forms of treatment for opioid dependence. I'm actually going to turn things over to Dr. Stancliffe, and she's going to talk about a program we have called TANS.
Does it sound good? Okay. So, yes, we have a new program. It's called the Transcutaneous Auricular Neurostimulator, short for TANS.
I like that better.
Yeah, right? So this is a new FDA-cleared device, pain-free device, in which patients wear as they're going through opiate withdrawal. So one of the biggest barriers for a patient that is opiate dependent is going through opiate withdrawal. And so this device, they take home with them, and they utilize it for as long as they need as they are going through withdrawal. The nice thing is they can, as they're going through withdrawal with the TANS, they can participate in our treatment. So they can come into our IOP, they can come into our individual and our group therapy while they are actually going through withdrawal. The TANS actually cuts down on opiate withdrawal within an hour or 2. We have seen so far, the ones that we have utilized have all been very successful. We had a gentleman using $1,200 worth of oxycodone a day. And we were able to get him through withdrawal within 5 days. He said it was the mildest withdrawal that he has ever experienced in his life. We also had a set of siblings that were using for over 30 years on an everyday basis. And they both went through the TANs, and they both had very mild withdrawal symptomology. So we're seeing a very positive result with our TANs. Harford County Health Department was kind enough to collaborate with me on this, and they were able to purchase the devices. So it's at no cost to our patients that are opiate dependent. And then we utilize their insurance for when they're in our intensive outpatient program or group or individual. So it's really at no cost for the patients who come in and are screened for opiate use disorder and want to start to live an opiate-free life. Any questions?
Dr. Stancliffe also works at the hospital. That's why she said health department.
Did I say health department?
No, you said you worked with us at the
Okay.
health department. Any questions on that?
I think we're going to come back with questions at the end,
All
okay?
right. Thank you very much. Appreciate it. Okay, so a couple more. So we would like to thank Council President Vincenti and Council and County Executive Casserly for the additional $750,000 in funding for the Health Department's environmental health program. I want to be clear that the funding is to cover a deficit in the environmental health budget going into FY24 and will allow us to maintain our current level of staffing. This is not intended to hire new staff, which would take us over budget again. For 10 years, the health department has been level funded by the county, and we have covered the costs from our collections programs. That's not sustainable, so we are grateful for the increase.
And Marcy, if I may, I want to thank my colleagues for supporting.
Yes.
Without their support, it would have never happened.
Yeah, I realize that. So, going back to that, the memorandum of understanding that we signed with the county on May 9th also includes the health department's integration of all environmental health duties and programs into the county's EnerGov system. This will eliminate double data entry of field and administrative staff. So now, I'd like to now introduce John Resline, Acting Director of Environmental Health. John has been with the Health Department for over 20 years now and has risen through the ranks. He has become skilled in handling high-level complaints and concerns and always finds a way to either solve the problem or lead us in the right direction for the solution. I thank John for the things he has taught me in the environmental health arena, one of which is to never ask what is in that cooler. That will become clear in a few minutes.
Okay, thank you. Many of you on the County Council may think that the Bureau of Environmental Health is all about building permits, septic permits, soil percolation tests, subdivision of land, food permits, and all that is true, but tonight I'm going to tell you about our rabies program and the story of the potentially rabid horse. Around 7 p.m. on Wednesday, April 26th, I received a call on my cell phone from Harford County Emergency Services. They have a concerned citizen in Councilman Riley's District D with some questions about rabies. So they patched the citizen through to me, and she begins to tell me, what her situation was. So her mare received a foot injury of unknown origin a few days ago, and her husband was caring for the mare. So on Tuesday, the 25th, the mare's health began to decline, and they decided that they were going to call a vet to take a look at the horse. So Wednesday, the vet comes to the property, examines the horse, concludes the best treatment was to euthanize the mare. The diagnosis of the vet was thought as tetanus, but rabies couldn't be eliminated, so the vet wanted the mare to be tested. There was a lot of rabies symptoms that were kind of being expressed by the mare. So anyway, the property owner wanted to know what to do. So I told her, at this point, you can't really do much. You just have to keep your pets and the foal that is sharing the paddock with the mare, separate. Keep, any people from the mare, and we'll be in touch with you in the morning. So I asked her to send me some information about who was the attending veterinarian, the onset of symptoms, the type of symptoms. So she sent all that to me Wednesday night. I forwarded it to Dan Driscoll in my rabies program, who manages that. And basically what we find out was, the horse had, these were not the original owner of the mare. There was no known vaccination history, so we had to, kind of assume rabies was a viable diagnosis. So early in the morning on Thursday the 27th, Dan gets in contact with, Dr. David Crum of the state of Maryland's, he's the state of Maryland's veterinarian, to discuss how to approach this large animal specimen. Dan has numerous contacts between the property owner, the veterinarian that attended to the mare, the Dr. David Crum, Maryland Department of Ag, and it's concluded that, the health department is going to handle all of this. So I needed to send 2 staff members with rabies pre-exposure treatment to the property. So basically, Dan Driscoll and Hannah Lux go to the property mid-morning on Thursday the 27th to obtain the horse head. So with a specimen that large, you can't take the whole animal. So you have to just take what you can that contains the brain. So Dan's purpose was to hold the clipboard and Hannah to do the heavy lifting, as you can see in the picture. Basically, I'm told Hannah's just too intimidating when she holds the clipboard. So I had to switch the roles around. And the property owner, there was a lot of back and forth as to who's going to remove the head. And it was kind of agreed that the property owner was going to do it. So Dan and Hannah get there. The property owner removes the head. I'll spare you from the pictures and the details, but they remove the head. They pack it in the cooler, triple bag it, put it in the back of one of our trucks, and they have to drive this specimen to Frederick County because Frederick County Department of Agriculture is the facility that's closest with the capability of extracting the brain. So we drive this to Frederick County Department of Ag, which happens to be right across the street from Frederick County Health Department. They do the removal. We take the specimen to Frederick County Health Department because their courier hadn't arrived yet, and they agreed to have their courier send this to Baltimore's laboratory for testing. So the other reason why that was kind of critical was we weren't entirely sure we would get back to Bel Air in time for our courier that goes to the state lab every day. So we take it to Frederick. Frederick removes the brain. Frederick County Health Department sends it to Baltimore, and then we just wait for testing. So on Sunday, the 30th of April, Dan is in the office working a rabies clinic for dogs, cats, and ferrets in Havre de Grace, and he sees the result comes available in the computer system. So he had enough time to talk to the property owner and relay to them that the result was negative and kind of, relieve some of their concern. And they were very appreciative for the information, and, they sent Dan a thank you email. So why is this important? In this case, there were 3 potential human exposures. The husband, the wife, and the granddaughter. And the granddaughter was the most vulnerable because she routinely would give this horse, kisses on the mouth. And there was the animal exposure of the foal in the same paddock. So fortunately, the result was negative. There was no need for post-exposure treatment of, any of the citizens or the foal, and everything sort of returned to normal. One of the things I want to just point out to you is, on a routine basis, a rabies specimen leaves environmental health. In 2022, we submitted 198 specimens for rabies testing, and 21 were positive. As of April 30th of this year, we submitted 41 specimens, and 6 were positive. Currently, Harford County is second in Maryland for positive rabies specimens for 2023. Frederick County is first with 14 positives. And I think that's all I have.
Okay. You can stay up here in case they have questions, but I just have a
Okay.
couple more thank yous here. So I want to thank Dr. Jamie Seibel for her leadership during the tuberculosis case that hit the news over the last few weeks. She and Jennifer Manigold, Director of Clinical Services, led the Health Department's clinic team in working with Harford County Public Schools to reassure staff and students by providing TB education and performing contact tracing and in-school testing. And last but not least, I wanted to extend a huge thank you to Rania Nassar, Director of Population Health, who is always there to assist with anything I need and what anyone else needs. She is that indispensable person who is always either one step ahead of me or right beside me, and she always has my back, so I thank her for that. So that's it.
All right. Let me just thank you again for the service that you provide all of our citizens throughout the county. Most council members have an opportunity to deal with you on a regular basis, both you, Ms. Austin, and Mr. Resline. And you're always efficient, you're always there to answer our questions. And that's why we felt so strongly to support you in your request for the funds needed to help you, assist you in what you need to do each and every day. So, council, with that, open for questions. Mr. Penman.
Thank you for the presentation and your work. You've been a great partner to the council and the community. I did have one question concerning veterans that may seek help through addiction. Do you have a liaison within the health department that will help them to get to the VA? And
So probably we do. So maybe one of you want to take that. It's more than likely.
Usually we try and work with county government. I know that they have some really good contacts there. A couple weeks ago, we actually went to APG and had a mental health symposium, so we were able to give out all our information. Someone from the state we actually made contact with, so hopefully they'll be able to provide us with some necessary referrals. So we don't have anyone directly in-house, but we try and work, thank you. We don't have anyone directly in-house, but we try and work with, collaborate with community partners as much as we can.
well, the new chair of the Veterans Commission, Jim McMahon Veterans Commission, has been a great help to me on a recent issue, so maybe he could be of help to you in the future cases as well.
What's his name?
Bob Brown, Robert Brown.
Okay. Okay, thank you.
Thank you, Mr. Penman. Mr. Giangiordano?
Good evening, Marcy. So
Good
thank you
evening.
for the update. Actually, some really good information. I've got a couple of questions on a couple of different things. Medicaid renewals. So does everybody renew in March, or is it staggered?
They renew when they run out. So whenever they applied, they'll renew on the year, the month.
The month?
The month,
Okay.
Yes.
So, so everybody through March of 2020 automatically renewed through April of 2023, but if they renewed after that, then that's a whole different story.
They're going to lose, some people are going to lose their coverage because they don't know they have to renew.
Okay.
So that's why our staff has been reaching out, calling, and trying to
And if
find
they go online to-
thousands of people, I might add. It's-
I'm sure. And if
it
they go
is.
online to marylandhealthconnections.gov,
Yep.
they can see their status, or they can renew.
They should call us because we can help them renew.
Okay.
They could do
So,
it that way, but we're right here to help, so.
okay. So now, second question goes to the dental program. There's no number here for the dental program. So, but you're saying that as of participants who are enrolled in Medicaid as of January 2023 automatically get comprehensive dental coverage, the adults.
That's adults, yes, because so far, adults didn't have coverage for
So
dental.
do they then just go to the two clinics?
They call our Edgewood Clinic because that's the clinic that has the general dentist. And so they call and make the appointment. So far, because of the demand, we've started with the parents of existing patients. We felt that was fair to start with the parents of the kids who already come see us. So far, we've only been able to accommodate 122, and I would imagine there are lots more out there.
So is that the 877-1040 number?
No, it's, not gonna remember off the,
It's not on here.
922.
Does anybody have the number?
Hold on, because we,
Just because it's not on the,
yeah, definitely we can get that.
it's not in the slide for the dental program.
All right, the number for the dental clinic in Edgewood is 443-922-7670. And that's at 2204 Hanson Road in Edgewood, Maryland.
Okay.
The other clinic we have is strictly pediatrics and pregnant moms, right?
That's what I
now.
thought,
There's
but now this
pediatric
is opened up to,
adult.
and apparently we have one of the higher rates for uninsured people in the state of Maryland, which is 4%.
Actually, one of the lower rates.
Oh, one of the lower
Yeah,
rates.
that's written a little bit different, but that's a low rate.
Okay, I was going to say, I thought that one.
Yeah.
And then the dental program looks like it does a lot of different things. I think I saw that too, somewhere. Okay. So,
We do school outreach. We do some, go into the Title I schools and do, take a dental chair right into the schools and do some services there, dental sealants and things.
so the diabetes prevention program, that's for anybody, correct?
Yes.
Okay. And that's in association with the University of Upper Chesapeake, correct?
Chesapeake, yeah. And some of our staff are now teaching those classes.
I'm sorry, what was that?
Some of our staff are now teaching those classes.
Now we can hear you.
You can hear me.
Okay. There was another question I had here as well. How many of these TAN units do we have?
I will take the mic on that one. So we, at present, have 7. And then we applied for another grant, and so hopefully we can get another 5 more. So hopefully by July, we would have 12.
Okay. Are
And
they
we
all?
reuse the computer one. We just don't give back, we just don't need back the earpiece or the wires, but we use the controller over and over and over again.
If somebody doesn't bring them back, I mean, is that an issue?
So far, we haven't had that issue.
Good issue.
Yes, because I
Don't jinx
talk
it.
with them a lot, that I need that back. and
How
the
long do
reason-
they need to wear these for?
It depends. Each patient is different, so it could be a day, it could be 3 days, it could be 7 days, it could be 14. But they're constantly in our clinic on a daily basis, except for the weekends, so that we're adjusting it if we need to adjust it and assessing if they need anything extra and how they're doing with it.
Okay. And what is it that it's doing that's making them, you didn't elaborate
Great
on that?
question. Are you ready?
Yes.
Okay. So kind of just the basics here. So when somebody is using an opiate, whether it's prescription pain medication, fentanyl, heroin, whatever, that opiate goes to our systems, right, goes up to the brain, and it bonds to what's called an opiate receptor. So when patients continuously use, all of a sudden they stop using, that receptor that had that opiate on becomes really super excited. And that's what produces opiate withdrawal. And so opiate withdrawal is the yawning, the sweaty, the GI symptomology, the muscle aches, the insomnia, the restlessness. So what the TANS does is it stimulates the vagus nerve in our brain to release our natural endorphins, which are opiates. And so the natural endorphins go bind to that opiate receptor and say, stop being so excited. And so it helps reduce the withdrawal symptomology within an hour to 2 hours.
Okay.
It's pretty cool.
Very interesting. Is morphine an opioid?
Yes.
Morphine is opioid. Okay. And I thought I had one other question, but I appreciate all the answers. And there's a lot of information here, so okay. I think I'm, oh, the Happy Healthy HUD program. 62 homeowner, have homeowners insurance, meet income guidelines. Income
brought-
guidelines aren't
I
listed.
brought it with me. I thought you might ask.
You're good, Marcy.
So.
I don't know who's good, Marcy or me, if we're asking. I know Marcy's good, I'm not.
So the median income limits, okay, so for one household, you have to make, the max is $62,600. 2 households, $71,550. So that's
So,
their
so if you're,
maxed salary.
if you're a senior and you have somebody living with you, does their
That's-
income count?
We're only basing it on.
It does count,
Yeah,
okay.
Kim runs it.
So they have a caretaker or they have a child living with them, both incomes count? Okay, that's good to know.
And it still caps out at these numbers, yeah.
Okay. I appreciate that, and I think just a lot of great information, and we certainly appreciate all you do. And then the last question I'm going to have is, John, why did you bring up the horse?
To distract you.
I feel like I'm in a movie, so.
It was Marcy's idea.
Marcy's
Oh,
idea, all right.
no.
You throw us off this end. So I do appreciate all your efforts. You've been a big help. Your staff has been a big help. Some of the restaurant inspections I've done, Dustin, I don't think he's here or not, but everybody's been very thorough. And it's been a big help, so I do appreciate all everybody's doing, and I'm glad you got your extra funding. So thank you, Council President.
Thank you, Mr. Janjardana. And Mr. Bennett?
Hello.
Hi.
I'm excited to hear about and see about the IU We Matter Youth Symposium coming up very shortly. I noticed on the poster for it, it said, the first 100 to register will get a T-shirt and a swag bag. Or have you already passed that already, or are there already 100 people getting a T-shirt?
Have you gotten 100 people yet?
We haven't reached 100 yet, so they can come on that day and register.
I'll try and just push that out on social media to make sure people know in the Aberdeen, Havre Grace area, especially to be close by and to be able to have something exciting to do on an evening.
Yeah,
So
thank you. Thank you. Middle school and high schoolers. Thank you.
Can you send us out in digital form?
I'm sorry?
Thank you, Mr. Bennett. Mr. Riley?
Marcy and John, I appreciate you and your staff, and I like that you say you provide services that achieve health equity throughout the entire county, and I hope we can work something with the Highland Center. How about the Behavioral Health Bureau? Is that also located in Bel Air? Yeah, everything seems to be Bel Air.
Third floor of the 120 South Hayes building.
The other question I had is, you talk about total deaths in calendar year 2022, opioid-related deaths. Do you have any location where they are so that we as council might know if it's in our district or not in our district?
I think they do map it.
So we do get reports from the state that actually map those locations, and we'd be happy to share it with you guys, just
If you
so
could
that
share
you
that
guys
with me, I'd
can make
appreciate
some
it.
more targeted outreach.
Thank you.
Thank you, Mr. Riley. Mr. Guthrie?
Thank you, Mr. President. Marcy, it's good to see you again.
See you.
And I was just, that horse's head thing, I thought maybe it came from that Godfather movie. I'm not sure, but that was more information than I ever needed to know. We have a fight with this mic here. I have to get that fixed. The dental clinic.
Guthrie Clinic.
Thank you for that.
It's still
plug.
going strong.
What I'd like to hear from, can you give us a kind of when it started and how many we were serving and how many we're serving now, how well it's done over the years?
Started in 2008, with a grant from the Community Health Resources Commission. It was a $485,000 grant, and basically they gave it to us for 1 year and told us that we had to be self-sustaining after that. And so the year before that, a young gentleman that I've spoken about before, Diamante Driver, passed away from a tooth infection. And so the following year, they did raise the rates for reimbursement. So in 2008, that very first year, we were able to make collections. And so ever since then, we've been self-sustaining. That's the only program in the health department that doesn't get a grant, except for the school programs. And so over the years, I think the first day we had 7 patients. And then
Oh,
over
a
the
little more than
years,
that now.
we have 12,000, patients now.
12,000 a year?
No, but a total of 12,000.
Oh, okay.
We have about 4,500 visits a year. That includes both dental and hygiene. So that's 4,500 patients coming through the clinics. It's really picking up over at 1 North Main. And so we think that's going to be just as successful. We have a pediatric dentist over there, right on Main, and people are finding it, so it's working out very well.
All right, the other one, the TAN, which I'm never going to try to pronounce that word. I wanted to ask you this question. Maybe you have nothing to do with this, but I'm going to ask anyway to try to find out. The detention center. We have a lot of drug problems in the detention center and trying to deal with getting them rehabilitated. And I hear all the wrong stories. I hear that we just give them drugs. And do you have anything to do with I noticed this TAM program would be great if it was in the detention center. Is there a way we can do that, or what?
Not really in there. We used to have programs in the detention center, but
We were involved in the detention center at one point in time. They have opted to go a different way, and so we are no longer involved with the detention center.
You know the way they went?
Well, was it 2023? All detention centers have to have the ability to serve all 3 MATs, meaning methadone, Suboxone, and Vivitrol. So you would have to ask truly the detention center which way they went, but because they were mandated to provide all 3 MATs, they're not involved in detoxing.
So they're not involved in the detoxing. Is that what you're saying?
Correct. Because of the state legislation, they have to provide medication-assisted treatment, better known as MAT.
and they've contracted
And so
with
they've
someone else.
contracted with someone to provide methadone.
I mean, is it supposed to help them get off the drugs, or is it just pacifying, which is a
Well,
Good
you know,
word.
MAT has its place in patients that are opiate dependent and no longer want to be using opiates. And so methadone and Suboxone are FDA approved for medication-assisted treatment for patients that have opiate use disorder. And so the detention center went with another contractor to provide methadone for patients so that they're not going through withdrawal while they're in the detention center, and that they would be maintained then on methadone while they're in the detention center.
So they get the same, they don't give lower doses and lower doses?
You
They
would
just-
have to ask them.
Okay.
I'm not involved in it.
All right, thank you. Thank you, Mr. President.
Thank you, Mr. Guthrie. Anyone else? Mr. Giangiordano?
Just want to make sure, I don't know if you heard me, if you can send us this digitally so that
Yes.
we can
Oh, I think it's in
share, post this Facebook.
Oh, you're
I don't know if you
talking
have
about the
specific
flyers?
posts, flyers.
flyers,
That,
yes.
that are digital, ready for Facebook so that we can put these out. I would appreciate that.
Okay, yeah, we put a couple flyers in there, but that might not have been one of them, so we'll send them to you.
Yeah, if you could send them digitally, then we can forward them, because I
Yep.
think just awareness will really help too.
Okay, great, thank you.
Thank you.
Okay, with that, then we'll move on. Board of Health appointments. Office of Mental Health, Core Service Agency of Harford County. May I have a motion?
Council President, I move to approve the appointments of Lynn Winkler and Sean Michael Martin.
May I have a second?
Second.
Thank you, Mr. Guthrie. It's moved and second to approve the appointments for the Office of Mental Health and Core Service Agency of Harford County. Is there any discussion? Seeing none, Ms. Dixon?
Mr. President?
Aye.
Mr. Guthrie?
Aye.
Mr. Penman?
Aye.
Mr. Giangiordano?
Aye.
Mr. Riley?
Aye.
Mrs. Bull Saddles?
Abstain.
Mr. Bennett?
Aye.
We have 6 votes affirmative, 1 abstention. The appointments are hereby approved. Are the individuals with us this evening?
I think they made me aware, because I guess I have to approve it too.
All right, well, thank you. And then next, if I may, Marcy, if you would, and Dr. Stancliffe and Ms. Pappas, come forward. You guys can stand. You guys can stand.
Whereas Mental Health Awareness Month is recognized nationally each year in May to bring attention to the crucial resources used to combat and overcome the stigmas surrounding mental illness. In 2023, The theme of Mental Health Awareness Month, Your Mind Matters, highlights the need to join together in advocacy for improving the nation's mental health care system. And whereas this year, the Harford County Office of Mental Health is partnering with several agencies and organizations to provide wellness events throughout the month of May. These events include a Children's Mental Health Matters campaign and a family wellness night. And whereas Harford County has a number of resources to help those who are in need of mental health services, the Office on Mental Health is joining with the Core Service Agency of Harford County to increase the knowledge of behavioral health disorders, raise awareness regarding the impact of mental health on our local community, and decrease the stigma surrounding behavioral health. Now, therefore, we, the County Council of Harford County, Maryland, on this 16th day of May 2023, do hereby recognize Mental Health Awareness Month, May 2023.
And if I may, I just want to turn this mic on. Okay. We good? I just want to thank you for the service that you provide all of our citizens, as we said earlier, the work that you do for mental health and Core Service Agency, both of you, all three of you, and all of you, actually, we appreciate very much. And if I may.
Shall we let them speak?
Yes.
Thank you. Thank you so much.
Yes, thank you all very much for all of your support.
Very
Thank you.
good.
Doc, you look shocked.
But no budget.
Twist that chair.
I believe, if I may, we'll go ahead and we'll roll into our public hearing. So I'll call to order public hearing for Bill 23-011, Apartments B3, General Business District. Mr. Grimm? Good evening, sir.
Good evening, Council President. Good evening, Council President Vincenti and council members. I'm here to present to you Bill number 23-011, and this bill is to remove apartments from the B3 General Business District. And the purpose in general for this bill is to remove these apartments as we feel that the remaining inventory of B3 lands within the development envelope is significantly diminished. At this time, we have about 305 acres of B3 zone land that is developable within the development envelope. And just because I'm saying 305 acres, that doesn't mean that entire acreage is developable, because certainly they're going to have some parcels that have significant environmental constraints and things like that. So the actual number is probably quite less than that. So we want to preserve and maintain some of those parcels so that we can use those or see those developed for purposes that are good for economic development in the county, and also to some of the apartment complexes that we've been seeing that have been being constructed throughout the county are in locations where there aren't walkability, where there isn't walkability to amenities, and they're located at crossroads that have significant challenges to crossing highways and things like that to get to amenities. And a lot of these apartments you really want to see in those areas where there's amenities are available and they are walkable. One of the things that we did was we did leave in this draft, or this bill as proposed, we did leave in the ability to do apartments in the B3 district when it is part of a mixed-use project. We felt that that was important to do that because when you have a mixed-use project, you're generally incorporating those types of personal services and retail uses that are meant to serve a community that would have apartments and potentially also a mixture of other types of units as well. So we did preserve the ability to have apartments in the B3 district as long as they are part of a mixed-use project. In the last 15 years, we have developed approximately 1,700 apartment units in the county, so that's a pretty significant number. And again, the main push for this is really to preserve some of those lands that are remaining so that we can use them for economic development purposes and try to entice some nice uses, retail and service uses into the county to serve the existing neighborhoods and, of course, the neighborhoods that are now being constructed in the county. And that's all I have at this time, sir. Thank you.
Thank you, Mr. Grimm. Mr. Penman.
Mr. Grimm, thank you so much. Over the last 6 months, you've been a great help to me, just trying to understand everything. And I understand the rationale that you explained about limiting the apartments in the B3, but again, we find ourselves limiting a major permitted use from a specific zoning code outside of master plan use and redistricting, which is coming up rather shortly. So was there an initial reason why this bill was brought forward? Was there initial reason why right now we chose to do this?
Well, we routinely do analysis of remaining lands within the development envelope. Specifically, we do analysis all throughout the county, but we really look at the inventory within the development envelope because that's where we're going to see that type of development because we have the infrastructure available, we have water and sewer available, where you're not going to see apartments and things like that outside the development envelope. So we're always analyzing to see what we have left. And it became apparent when we started looking at the industrial districts and the commercial districts as well that we are rapidly diminishing in the overall acreage that we have for the B3 district. So that was really the impetus.
Are there any projects that are currently in the permit process that will be held up from this bill?
I'd have to get back to you on that answer. What I can tell you is that projects that are out there that you have seen that are actually under construction and they've come up from the ground, from the foundation, they will not be impacted by this bill.
So if you have an apartment complex in a B3 that plans on renovating, expanding, essentially we would be eliminating them as non-conforming uses. I mean, how would that be handled in the future if there was an expansion or remodeling project for different apartments that is in the B3 zone?
That's an excellent question, sir. With expansions, that's where we really run into the non-conforming section of the code. And the non-conforming section of the code does allow for expansions up to a certain point, and then also you have the ability to go to the Board of Appeals to ask for expansion of non-conforming uses. Typically renovations and things like that, certainly interior renovations, this has no bearing on those types of things. You know, you'll see apartment complexes that will over the years go ahead and renovate the exterior of the property. Those types of things aren't affected by this bill, but certainly expansions of apartments. But I can tell you in my career, I've never really seen anybody come in and expand an existing apartment complex or existing building. I'm not saying that that wouldn't happen, but that's not something typically that we see.
Thank you, Mr. Grimm.
Does this stop, would this stop, if approved, some of the workforce housing that has come to us in the last few years, like mandated through federal government?
If it were to be located in the B3 district, yes.
Mr. Guthrie.
Not knowing where I am at on this bill yet, I wanted to ask a question which I don't quite understand. We know B3 is the best zoning code for building of businesses in the B3. However, if you want, you can build houses in a B3. It's kind of dumb to me that anybody would want to build a house in a B3 zone because, you know, that's a great zoning thing if you want to put a business in there, but that's possible, right?
That's correct, sir.
Yeah. So I don't know whether, are we limiting the people in our county that own this property who decide to want to build a house or want to build put it in an apartment complex or a business? You know, are we limiting their ability to do that?
Well, one of the things I'll tell you, this question.
Because they have it now. They have the ability to do it now.
Correct.
Right?
Correct.
Okay.
One of the questions that this question came up during discussions internally, and yes, you can do a single-family dwelling in the B3 district. That's very rare. We
Yeah,
rarely
very
see
rare.
that.
Absolutely.
Typically, we would only see that when it's a marginal parcel, very small, not of a size that is capable of handling commercial development. And also, typically, what you see with B3 zoning historically is B3 is along major corridors, arterial corridors around the county. You don't see vast parcel acreages of 100 acres of B3. It just doesn't exist. You see 5 acres here, you see maybe 10 acres. So typically, you're not going to see a parcel of a large enough size or configuration to allow for, say, a 50-lot, single-family development. It just doesn't happen. We have seen throughout the past, not so much in the B3, I've seen in Joppa, off, I think it's Goose Pond Estates many years ago. My memory still works. You know, a portion of that property was zoned B1. And if we look at the old maps from 1957 when we had when zoning came into Harford County, a lot of those zonings, B3, B1, B2, were just folks sitting around the table with literally crayons and saying, hey, I have this use here in the middle of nowhere. Give me B3, give me CI or whatever. So there are some strange kind of business zonings that don't make sense, and the explanation for that is they're historic zoning. There was someone had a mom and pop shop at the intersection of Joppa Road and wherever, and it's long since vanished, but they were given that B1 zoning. Those are the types of things where we see residential development happen, but even that is kind of an anomaly.
So this is not geared at anything that's being proposed now that you know of, or do you know?
No, sir. Again, it's a reaction to looking at the inventories that we have in the development envelope. You know, our development envelope is rapidly maturing to build out. And those remaining parcels that are located within a development envelope, whether they're zoned commercially or residentially, the ability to develop those parcels is significantly limited because all of the, what I'll call good parcels, have been developed. And the remaining parcels have challenges, and that's why they haven't been developed. So, you know, they're marginal at best.
Okay, thank you.
Thank you, Mr. Guthrie. Mr. Bennett?
I just wanted to turn on my microphone and also just say I'm glad to see that we're protecting mixed-use development plans. Mixed-use development makes it so you're closer to all those services and community, businesses and so on and so forth at a walking, path. And when people walk to the butcher shop, or when people walk to ice cream, or people walk to their local department store, that saves us money on road maintenance, because the farther people are away from those core services, whether it's their local school, their library, the more expensive they are as a resident of the community. And I just think mixed-use development plans are fiscally mindful to make it so it's cheaper to exist in your community because everything's at an arm's length away. And it also makes a higher quality of life. It's nice to be able to, outside of going to work, never have to step into my car because everything's right there for me. I just think that is a good future path for us as a community to develop those types of mixed-use development plans. Is that something that you all are looking at into the future, of looking for more of those? Is that being prioritized through a bill like this, or?
Certainly, it's going to then, those folks that still want to do apartments and apartment developers are going to have to look for properties where they can incorporate mixed use into that, so they are able to do apartments like you're saying. And I appreciate those comments that you have, because mixed use is really kind of a planner's utopia, and it's tough to really get a really good mixed use project. And there have been a couple in the county. I wouldn't say that they're the ideal of a mixed-use project, but I can tell you, for example, like Box Hill Corporate Center, that was sort of a little bit of a different project in the way it came about, but it's situated in an area that is walkable. You can go to Wegmans, and you can go to a whole host of different amenities, and you have transit right there. That makes it really kind of the ideal, or close to the ideal, of what a mixed-use development should be. And to speak to what you're talking about with people not having to get into a car, hopefully, to travel, it really reduces what we call vehicle miles traveled. And that's a big thing in mixed-use development and traditional neighborhood design, is try to reduce those vehicle miles traveled.
Thank you, Mr. Bennett. Mr. Giangiordano?
Thanks, Mr. Grimm. So I know in my district, there's been a couple apartments that have been built. I know that puts an extra tax on, I don't mean tax, but I mean taxing on the emergency services that, can create that. So, and then there's another apartment that came up that we didn't know anything about, that we found out, I think, in a meeting with yourself in District D, that we had no idea that was being built in a B3. So in the past few years, there's going to be 3 apartments pretty much in my district or close to my district, which I think puts a strain on the emergency services and that. So there was no limit on the height of those apartments. I think these are 5-story tall apartments. Is that correct? So in the B3, if you do a multi-use, they can still do 5 stories high, or is there going to be a limit on that of how?
There'll be a limit based on the property size, which will dictate what the density of that apartment complex could be.
So the height will be based on the density of that, unless there's some kind of an amendment that says they can only build so high, correct?
Correct. So you have what we call garden apartments, and those apartments are up to 3 stories. Then we have mid-rise, which are up to 5 stories. And anything above that is considered a high-rise. High-rise apartments are permitted in the R4 district, I believe under the planned residential development designation, and they have been for quite some time. We don't really see that really high-rise type apartment development. But yes, certainly you could see, if you had a project, a mixed-use project on a parcel that allowed for a significant amount of density, you certainly could see a fairly tall building, but I think that's unlikely in this county.
Okay, thank you very much.
Anyone else? Thank you, Mr. Giangiordano. With no one else, Mr. Grimm, thank you for your presentation, and we'll take this up at a future meeting.
Great, thank you, sir.
Thank you.
Mr. President, we do have 2 speakers
I'm
this
sorry.
evening.
Okay.
Bill Honorado, followed by Diana Sadowski.
Good evening, sir. Name and address, please.
Evening. Bill Honorado. I'm at 1803 Falstaff Road in Bel Air. Tonight I'm speaking actually on behalf of Friends of Harford. As an officer of Friends of Harford. Friends of Harford wholeheartedly supports this bill for all the reasons that Mr. Grimm laid out. I don't want to rehash all of that. I do want to provide, however, an example to provide a little bit of color to this. At the intersection of 543 and the Route 1 bypass, back in 2018, 2 of the 2 parcels at that intersection were upzoned to B3. Almost immediately, the plans came in for apartment construction. So we now have 1 project completed with 70 apartment units, and on the other side, it's going up. I think that's the one that you were referring to, for another 160. Now, specifically the one that's completed, I would encourage you, if you need more persuasion about this bill, take a field trip and go out and visit that property. That property it's a small acreage, completely surrounded by 543 and Route 1. So anybody who wants to walk to Royal Farms or to the Redners, they got to cross 7 lanes of traffic, 7 lanes, across 543, another 7 lanes across Route 1. Now, there's no crosswalks there. There's no crosswalk signals there. There's no sidewalks in front of the apartment building. Where there are sidewalks, they're incomplete. And this is all because it was probably anticipated to be business use, not residential, where people would actually be crossing the street. There's nowhere for the kids to play. There's nowhere for them to ride their bikes. There's nowhere to have a pickup game of basketball or anything like that. It's not really near the resources that these residents need. Now, I understand that there's a number of residents who want housing assistance. They probably don't have cars, so they have to walk. And that's just a dangerous intersection. So, I think the main purpose of this bill is to prevent repeats of what we're seeing at that intersection to some degree. And I think that's really why you should support this bill. Because if it's allowed, planning and zoning really doesn't have the ability to say no to a potential future project if it doesn't make sense. So the law is currently written, even if Mr. Grimm said this is the worst potential project at this intersection, he can't stop it because the zoning code allows it. So there's no mechanism to apply common sense. So again, if you need more persuasion to support this bill, take a look at that intersection, what's been built and what's being built there. So I would encourage you to support it. So thank you.
Thank you, sir. Good evening, ma'am. Name and address, please.
Hi, my name's Diana Sadowski, and I live at 1113 Stromco Drive in Fallston, Maryland. And I've been a resident of Harford County for 42 years. I've paid taxes dutifully. I've voted. I've raised a family here and currently have the joy of watching my grandchild grow up here. And as you can see, I've got some skin in the game with the development. I've seen many changes to the county over these 42 years. Some good, some not so good. I truly want only the best for Harford County so that generations to come can enjoy the good. The bill references apartments and mixed-use projects within a particular type of business zone. I say no to any type of residence in any type of zone, period, business zone. The business zone envelope in the Fallston Bel Air area is out of control. Have you traversed Route 1, 924, 24, 22, 152 lately? It's a cluster. In fact, there's going to be 3 car washes built at or near the 152 Route 1 intersection. Yes, 3. How many car washes are needed in Fallston? Imagine adding residences to the areas, and to others like it throughout the county. It only adds to the clusters everyone who has to deal with those roads are experiencing. Developers and development is out of control with their improvements to Harford County. Not just in the referenced area, but throughout the county. Developers seem hell-bent on just filling up any vacant area with brick and mortar, no matter what that brick and mortar is. We need to reassess where Harford County's going. We shouldn't become a city, a Baltimore City. Maybe we need a halt. Maybe we need to step back and take a breath and take a look at everything. Country roads are not supposed to turn into city streets, nor highways. And that, ladies and gentlemen of the council, is what's happening in our county. More brick and mortar development must not become a natural progression of rural lands. It only results in something no longer recognizable and not wanted by its residences. Remember, they paved paradise and put up a parking lot, or in this case, apartments. Keep going, and there won't be any more green grass of home. We say no and enough. Thank you for your time.
Thank you, ma'am.
There are no more speakers, Mr. President.
With no other speakers, this will conclude this public hearing on Bill 23-01. Thank you, Mr. Grimm. Bill 23-012, Appropriation Estimated Expenses, FY 23, Department of Emergency Services. Mr. Sandless, Mr. Woods, Mr. Bernicki, and Mr. Ayers.
Flip a coin.
Are we good?
I believe so.
Mr. Ayers, it's a pleasure seeing you this evening.
Thank you, sir.
So, Mr. Sandless, whenever you're ready.
Okay. Here with a request from the county executive for a supplemental appropriation to the Department of Emergency Services to be funded through a transfer from the fund balance. This is to cover the transition cost of the EMS transition from the foundation, the volunteer service, to the county service. I should note that the total cost of this first year transition, or remaining of fiscal year 23 transition, is $8.6 million. However, we had $1.6 million remaining. That was the fourth quarter payment to the foundation that did not have to be made due to the situation with the foundation. So that enabled us to kind of get a head start on some of these expenditures. And with that, I will turn it over to Director Ayers to kind of walk us through these expenditures in fiscal year 23.
Okay. Council President Vincenti and council members, thank you for allowing me to come and speak with you tonight. And I also want to thank the members of the Volunteer Fire and EMS Association that are here with us tonight as well, since we actually have 3 bills, I think, to discuss tonight. So the first slide, one of the big costs, we broke this down into big costs, actually. So the first is personnel costs. So, I'm sorry. So when we started the transition from the EMS Foundation to the county back in, I'll say, February of this year, we needed to hire at that time 104 EMS personnel, and they were broken down as 52 EMTs and 52 paramedics. Since that time, that was back in, I'll say, sometime in March. Since that time, we have already hired 71 of those number, and that leaves us with still a need of 33 to complete the transition. So we still need 20 paramedics and 13 EMTs, but we're well on our way from the 104 that we needed to hire back in March. We also needed salary and benefits for 3 months, pre-employment costs, and training of those personnel. Then we go to the next slide. The next big item was the ambulance purchases. We purchased 12 ambulances from the Volunteer Fire Service. Abington Fire Company had on the assembly line 3 units that hadn't been delivered yet. The county absorbed the contracts of 2 of those units, so that brought the number to 14. The county also has ordered 3 new ambulances, but it's taking on average about 2 years from the time you sign a contract to get an ambulance before it's actually delivered. COVID really slowed that down. And we also have leads on 2 additional units. And in fact, this slide's already outdated because we purchased a ambulance from Owings Mills Volunteer Fire Company today. So we're continuing to look at every possible avenue to add to our fleet. Warren Patrick, our fleet manager in the county, for every ambulance that you have on the street, you should actually have 1 additional ambulance. So say if we had 12 ambulances on the street, we should also have 12 ambulances in reserve for maintenance and when an ambulance gets in an accident or breaks down, and we're trying to get our fleet to that point. The next slide, equipment and supplies. This was mostly the equipment that we needed to purchase from the volunteer fire companies. So the fire companies, if they had large equipment on their units that we purchased, we also purchased the equipment that came with those ambulances. So that's what that slide's talking about. It was like a little over $2 million to purchase that equipment. When we talked to the volunteer fire companies, when we started this transition, to supplement their funding that they were getting for EMS billing, this $889,500 was to offset the money that they were losing from EMS billing when the county took this over. And it was also a cost for the improvements we needed to make to their fire stations that would accommodate our career people in their volunteer stations. And then the yearly vehicle maintenance costs for all of the EMS units in the county. And then if you look at the totals on the next slide, that came up to $8,619,500. It was offset by the allocation that the foundation would have received in the fourth quarter, which was a little over $1.6 million, which came to a total of $6,995,500. And with that, I'll entertain any questions, or Mr. Sandless will entertain.
And then as a reminder, anything, of course, that is not spent, because, this is a forecast and there's transition happening with different timing and the like, it would, of course, fall back to fund balance and be available for use in a future year.
Mr. Penman?
Mr. Harris, thank you. I think it's tremendous that you've already filled 70-something positions, which I thought was near impossible. So
So do I.
kudos to your team in the recruitment process. And Mr. Sandless may have just answered my question, because I support the improvements of the EMS system and the adjustments that need to be done. But with the amount of money that was spent, I'm just concerned about how it was brought to the council's attention. And it looks like now that most of the money's already been spent, maybe backfilled, really without the authority of the council, which, if you look at the fiscal note in the first line, it says, by law, no department may spend more than the amount that the council has approved. So if we already spent that, but now we're asking for permission to spend it, I just don't understand how that works.
So in the Department of Emergency Services total budget, they have not exceeded their appropriation. So even with some of this funding, because of course some of it still has to happen. So we have not gone into the red. Now, what has happened more or less is you have other aspects of the Department of Emergency Services that, in essence, kind of covered that expense. And then, had the council not approved this transfer, then of course it would have required some, or actually quite a lot of additional cuts or whatever in the remaining months. But we did not go into deficit spending on this amount. So we have not exceeded our expectation, our appropriation.
Mr. Guthrie?
Thank you. I certainly support this, and more so, I really support the cost of buying these ambulances, because I want to give you an experience I just had yesterday. Okay, when I'm sitting there having dinner with my wife, my mother-in-law, who lives with us, been living with us for 10 years. She's 97 years old. She just had a birthday Saturday, and we had her out for a party, and then we took her out Mother's Day. She's sitting there having dinner at the house about 6 o'clock. And my wife says, I heard something, did Mom say something? I no, I can't hear her over the TV because the TV is so loud. And she goes over and checks, and she screams and said, come over here. And I checked my mother-in-law, and she was clearly having a stroke. I mean, I know some of the symptoms, I know the paralyzing of the arms, and you can't raise your arms, and you can't smile, and all that kind of stuff too. And that was there, so right away I called 911. Got a lot of help from the operator at 911. It helped a lot. It gave me some things to go through, to ask her, and he agreed clearly she was in the middle of a stroke. And so we called 911, and he told me that ambulance, he called the ambulance already, it's on its way. Okay, so I thought that was great. And they said that the paramedics came in and they get her all ready, to go to the hospital. I go outside and there's an ambulance pulling up in my driveway. Guess what? Baltimore County. Baltimore County ambulance. So you think a councilman's got any pull? No more than anybody else. And they said there was no ambulance available. They're all out, And so that just goes to show you the need that we have. You never know the need that you have until you don't have it. And then you have an ambulance coming from a different part. So clearly we need these ambulances, and until you call and you can't get one in a serious matter like this, and they said at the hospital that they got her there quickly, and if you get them there within 2 hours, she had to go to Johns Hopkins Bayview, and they say that's supposed to be the best hospital in the United States for that kind of a problem. So certainly it made me, not that I didn't have my eyes already open, but they were wide open when I'm watching a Baltimore County ambulance pull up in my driveway and not a Harford County ambulance. So you got my full support.
Thank you, sir. I will tell you, a couple weeks ago, we had a couple episodes, 2 days in 1 week, on a Monday and Tuesday, where over a 2-hour period, we had over 30 ambulance calls in the county in a 2-hour period. So, I mean, that's how busy our our ambulances have been in the county.
Thank you, Mr. Guthrie. Mr. Giordano?
Good evening, Mr. Ayers. I think you're a little bit cleaned up over here, aren't you? I kind of noticed that. So anyway, I'm in support of this as well. 2 weeks ago, my father, 88, pulled out a newly sharpened Cutco knife and it dropped, hit his leg. He's on warfarin. He was bleeding, called me up real bad. I got over there. He had it wrapped up, but blood was coming out. I didn't know what to do. I called 911. Thankfully, somebody came over. He said he felt lightheaded. I said, take him to the emergency room. They put stitches in. So thankfully, somebody was able, that you had an ambulance that was there that came quick. So I do appreciate that. And I think having the paid people on the county's plans with all the benefits that they have and everything, that they can be on there for a while, I think that will help us, especially even down the road. I know we have some programs from the college where some of the EMT and everything, but I think we'll find that people want to stay in this county, they want to work from this county, gives us a good opportunity for it. I know this came about not the way it wanted to be, that we were hoping to phase this in over, a longer period of time, but they came to us and said, hey, we're done. We can't do this anymore. And thankfully, we stepped up and were able to get ambulances. You said it's a 2-year wait. So thankfully, we had ambulances that we can purchase from a lot of these places. We had, like you said, Abingdon had 2 that we're able to get, and you found another one. So as you build this stuff up, certainly I know some of the equipment on some of these things are certainly expensive. I know the strikers, we've certainly seen the cost of those strikers and how many units have them, how many don't. I'm sure you're going to wind up with more of those where, they can handle somebody who's large and, without hurting some of the EMS. So I certainly appreciate all you guys' effort. I've taken a ride or 2 in the ambulance, so I certainly appreciate that. And I don't have any other questions. Thank you.
Thank you.
Thank you, Mr. Giordano. Starting 2 new crews this weekend, is that correct?
Actually, we're starting Bel Air's unit for Bel Air's main station in town, and then we are starting a unit in Norrisville on Saturday as well. So that will put 13 county medic units in service, and when we started this in February, we had 4. So we went from 4 to 13 county medic units.
Very good. Ms. Dixon, do we have anyone signed up?
We do, Mr. President. We have one, Chip Riley.
Good evening, sir. Name and address, please.
Good evening. Chip Riley, 1911 Park Beach Drive, Perryman. I'm a big supporter and advocate for the fire and EMS system here in Harford County. Most of you know my background, so I'm not going to bore you with the details. Now, moving the county fire and EMS services is in a positive direction means keeping up with the demands of times here in the county. Funding projects to improve the services for citizens are always a good thing. This bill would help funding for many projects, such as improvements happening now in Aberdeen Fire Substation in Perryman. Please support Bill 23-0012. Thank you.
Thank you, sir. Anyone else, Ms. Dixon?
There is no one else signed up, Mr.
All
President.
right, with no one else speaking, this will conclude the public hearing on Bill 23-012, and we will take this up at another meeting. Bill 23-013, EMS ambulance transport increased rates. Again, Mr. Sandless, Mr. Ayers.
Council President, members of the council, bringing forth a proposal from the county executive to alter the billing process for our ambulance services. So under our current law, we enacted back in 2018, In order to defray the cost of ambulance services, we set our billing rates equal to the Medicare allowable rate for each transportation. Kind of with the idea that most of our transports were going to be probably Medicare related, and that of course that would change over time. We also allowed Department of Treasury to adopt rules and regulations for kind of the collection of charges for any waivers to be put forth in rules and regulations. We have adopted rules and regulations, and most notable of those rules and regulations is that we have agreed to accept whatever is the insurance payment, so we don't do balance billing. We wouldn't go after the individual for any additional funds. So what the insurance provider pays is what we accept. So this next slide just kind of just shows how we've changed over the years as we've gone from just one unit to adding more and more, just starting off with just shy of $70,000, moving up now towards bringing in around $1 million, have $3 million slated for next year. And again, I expect that this number again will continue to kind of grow over time. As we talk about with all of our fees, with the exception of our water and sewer fees, it will never fully capture all of the costs of running an EMS operation, just like we don't fully capture solid waste or other things. Again, water and sewer is kind of the unique entity when it comes to fees fully covering the actual cost. So one of the things that kind of came out with having a rate linked at the Medicare rate is, while that certainly does capture a lot of our perfectly kind of lines up with the Medicare individuals if we bill at the Medicare rate. And it also covers a lot of the individuals that are at the Medicaid rate. Actually, Medicaid only provides $100 per transport, and there's no negotiation or anything like that. But there was some thought that perhaps our rates are leaving money on the table, if you will, when it comes to private insurance, individuals not in those government programs, which is about 25% of our calls. And so that perhaps what was needed, and this was one of the things that came out of the transitions, one of the transition groups under the new county executive, is that we needed to elevate our billing costs so that we weren't in essence leaving money on the table. You all know when you look at your Care First insurance or whatever type of health insurance, you always will see something along the lines of what the rate the doctor charged, but then what was the allowable rate, if you will, by the insurance company. So in the past, what we're trying to make sure is that we don't have a rate that's lower than that allowable rate, which would in essence leave money on the table. But again, as with any of the with Medicare or Medicaid, we're not necessarily looking at balance billing or going after individuals. We just want to make sure that we're not underbilling the private insurance carriers. So you can kind of look at this study here, which shows, this was done by our billing group, which provided a comparison of the southern region of the U.S. You can see the top line deals with our actual rates. Those are the Medicare rates. You can see for ALS emergency about my vision gets. I need to take advantage of our vision plan more. At 505, our ALS 2 at 731, and our BLS emergency at 425. When we looked at this comparison study, you can see that we were certainly at the low end of any of the region's rates, and that if we wanted to try to get up to the average or the median, what we could do is elevate our rates. So what we opted to do is to take the Medicare rate, which again changes each and every year, and add 75%. And you can see that 75% for ALS emergency takes you up to 884, for ALS 2 to 1280, and then for BLS emergencies up to 745. And again, that kind of puts you in that average range, in that median range. And as I said before, we're not looking to balance bill. We're just mostly looking to make sure that we're not charging at rates that are lower than what insurance providers would pay. Also, of course, when we look around the surrounding jurisdictions, these rates will still be lower than what they're charging in Cecil County, and on par with what's largely being charged in a lot of the metropolitan areas as well.
Okay. What's our history been with billing? Have we done our due diligence in billing in the past?
Well, I mean, again, what we do is we don't have a very active collection process. I mean, there is a limited collection process with with billing, and I think this is going to do more in the lines of getting our billing, at least as far as what we are billing, in line with what more market rates are. But I think it was the kind of the take of the previous administration, also the current administration, that we're not necessarily looking to engage in very aggressive collection patterns. For the most part, we're trying to work with what the insurance companies are providing. And there is a waiver process for those individuals who are not insured as well.
Okay. Counsel, Mr. Penman.
Mr. Sanders, thank you. I think here we are again with a fee. First, it's going to cost you more to call 911, and now it's going to cost you more for an ambulance ride if you should need it. So there was a recent discussion about some of the deficiencies in billings in the past EMS system. If those deficiencies in billing were repaired, would that have abated the need to raise the cost of EMS?
I'm not entirely sure. I mean, again, what we're just trying to do here is we're not necessarily looking to raise fees on anyone or raise any out-of-pocket costs. We're looking to just make sure that the fees are in line with what the insurance providers are providing. So the individual should not see any increase necessarily, because we have rules and procedures to accept what the insurance carrier provides. So I guess the insurance companies might potentially lose, and I don't know how much it's really going to be. I mean, we'll see over time. We know that the Medicare rate is what it is. We know that the Medicaid rate is what it is, and so this certainly isn't going to have any impact there. And I often find many times that even on the private insurance that the rates that the insurance companies kind of come back with under what's an eligible expense is sometimes even lower anyway. So, again, I think I don't know if we're necessarily increasing fees on any residents or visitors to the county. I think potentially, their insurance companies could be paying some extra, and I guess you could make the argument that could carry over.
Well, that would result in higher copays and all these things.
Well, yeah, but even like at your own, it would be like the same though at your own doctor. Your doctor might submit at a higher rate, but the insurance company is going to say this is what we pay for this ambulance service. So what we want to make sure, if the insurance company says this is what we pay and we're billing this, then the insurance company is going to say, well, we'll pay that. But if we're saying this is what we're charging, and they're saying, well, this is what we pay, well, this is what they're going to pay, and then we're not going to go after them, after the users, for that balanced billing. It's just to make sure that we're not, in essence, leaving money on the table.
I'm confused on how that works. The system I have, you pay 10%. So if you take an ambulance ride and it's $1,000, and that's the billable amount, I'm paying.
It's 10% of eligible costs. So like the next time you because I'm on the same insurance that you are, when it comes in, you'll see this is the billed amount, this is the eligible amount, and then you would pay 10% of that eligible amount, not on the total cost. So in essence, it's just trying to make sure that we're not in essence underbilling the insurance companies.
So I see the comparison here with the different providers, but in comparison of jurisdictions, do we know the comparison on Cecil County and Baltimore County?
Yeah, so I mean, Cecil County for ALS emergency is $1,359, ALS 2 $1,675, BLS emergency $920, whereas Baltimore County is pretty much $700, $750. Baltimore County just it wasn't that long ago. They were one of the last ones to try to get into the ambulance billing area, and a lot of the counties, the more suburban counties, have a standard amount of that 700 or 750 or 800 range. So our rate would be higher than that. However, it would be lower than the Cecil County rate. And when we look at the comparison study of the entire southern region of the U.S., we would be much more in line with the average and the median cost there.
All right, I'm going to kind of totally transition from the ambulance fee increase, because there's a whole nother segment of this bill that deals with the authority of the Director of Department of Emergency Services, essentially the county executive, over volunteer fire companies. So my concern is that the county...
and I think that's the next bit of... Is that the next...
It's in this bill, too.
It's in this one.
Oh, I'm sorry. It is in this one. My apologies.
They overlap into both.
I think that's kind of... And that was one of the reasons why I think it kind of took a while to get everything over, but yes.
Well, if you don't mind, I'm just going to read this bottom portion so everybody's on the same page. The bill would also give the Director of Department of Emergency Services the authority to establish to facilitate fire, rescue, and emergency medical services in the county. The Harford County Volunteer Fire and Emergency Medical Services Association Incorporated may appeal decisions made by the Director of Department of Emergency Services with the county executive responsible for the final determination. And what I'm concerned with this is the county executive or the county administration trying to take over the fire companies, right? So this would give the almost complete authority to the county administration, you essentially, and then through the county administration. So, and then obviously conferring with the association, the fire association, but there's really no arbitration in here if they come to an impasse of a certain issue they disagree on. Now, Mr. Ayers, you have tremendous history, experience, expertise. This is nothing to take away from you, but we go 8 years down the road and there's a new county executive in place, and maybe for political purposes, they put somebody with a whole lot less experience in a position that you're holding, and now they're influencing decisions on the volunteer fire company. So I know that we had talked about some amendments going into this bill, but I don't see the amendments to make sure that it has the arbitration, hopefully a binding arbitration, so an independent arbitrator can come find that impasse and find that middle ground.
So I talked to President Iyer from the association today, and Vice President Bill Deuce is here tonight, and I think he's going to speak. The fire service did support the next bill, I guess, that we're talking to, but you're correct, they do overlap. They approved the legislation with the ability to appeal a decision to, their original vote was to appeal to like an arbitrator or something like that. But they wanted to take it back to their trustees in a couple weeks to decide again whether they feel like, and I'm sorry, Bill, if I'm speaking out of turn, but I'm kind of speaking for what I think the fire service is taking that back to their trustees to see if the arbitrator is the right way to go. But yes, they do want a way, if they don't agree with either my decision or the county executive's decision, to have a way to go to an arbitrator. So I think we're going to support whatever amendment they want to add to this law to give them the right to do that.
Was there a catalyst to try to take over the control? Is an issue with the fire companies to where they weren't performing adequately?
Some of the reasons, I mean, a lot of what's in this law was a language. Some of the stuff as far as the title of the volunteer fire service was changed. It was still under the old title from back in the 80s. One big section that was added was there was really nothing in the bill previously that directed the county executive to authorize payments to the volunteer fire service on a yearly basis. I think you'll see in the new law that we're going to talk about in a few minutes, it kind of directs the county executive to pay and support the association and its member companies. A large part of this bill was actually written by the volunteer fire service with the Department of Emergency Services. So I feel like they supported other than this one issue as far as how the arbitration would work.
I can tell you, I've met with several members of the association today, and without that amendment hopefully the cooperation from you and the administration, without that amendment to have an independent arbitrator with binding arbitration, I don't, to my understanding, I don't think they support this bill. I represent Falston. Falston's the only fire department, that essentially is in my district, and it's a great community area, right? So the partnership with the fire hall in the community through different engagements is important to me, and it's important to the community. So, and it's their own 501c3 program. So they own it themselves. Obviously, the funding does come through donations as well as the county, and that's one of the. I think it's in this bill, maybe the next bill. Essentially, if the county administration has an issue with some sort of training regimen that maybe it's in dispute, the county administration could technically, based off the authority in this bill, pull back that funding for any particular fire company. And that's what I have concerns about, is the amount of control, and I'm not saying it directly towards you, but this bill itself, the amount of control that the county administration is trying to inflict on the individual 501c3 fire companies is kind of alarming. So with that, that's all I have.
Mr. Giangiordano?
Good evening, gentlemen. What is the three different ALS emergency, ALS 2, and BLS? What do they
So
stand
the one ALS, for example, would be, maybe they'll start an IV and put somebody on a heart monitor, and then the next step up would be that, plus a couple more interventions where they would have to push drugs. So, like a cardiac arrest where they would have to do everything and give medications as well. So they're both ALS, but one requires a lot more intervention, so the billing rate for that is different. It's kind of a Medicare thing.
Okay. And I think, maybe to clarify to some other people up here, is balanced budget billing means that if the insurance company pays $800, but the bill was $1,000, they're not going to come back to you for the rest of that money. So it will not affect your copay or anything else. They're going to accept what's paid. We just haven't been charging the amount of money that they're willing to pay on a lot of these.
Charging less than what Medicare would even pay.
Correct. So there's a gap there, and that gap looks like it's going to be narrowed, but it's not going to be a cost out of anybody's pocket or an increase in anybody's copay or anything. That's what balanced budget billing means, is that you're not going to be charged for anything over what the insurance company pays for. They pay for it, that's it. It doesn't go to collections or anything like that. Do we use our own billing department, or do we use a third-party billing
So we use a
department?
third party. Medical billing is very, very complicated,
okay.
but we have a very close relationship. We use Quick Meds, which is who most of the volunteer fire companies in the county use as well. And then, of course, within DES, they have individuals who are largely working on billing, and then, of course, I have people in Treasury that are also working with them as well. And, of course, this past couple of months, I found myself learning a lot more about it as well, and on quite a few calls.
Did you do an analysis of how much more we would collect from the insurance companies based on the rates that we should be charging?
Yeah, it's difficult to say. What I do know is that it's about the Medicare, Medicaid, VA, all of that. That's around 75% or so. So it's about 25%. But even then, depending on the private insurance, because it's difficult to say how much below that it's going to be. I mean, we're working with Quick Meds to try to get a better understanding of that. But I think really time will tell on a lot of that part. But I don't expect it though to be. I don't expect our revenues, all things being equal, though, to just go up 75%. I certainly don't expect that. I think it'll be much more marginal.
Okay. Thank you very much. Thank you, Council President.
Thank you. Mr. Bennett?
My question's more so just procedural, because, this is a bill that its primary focus is this fee adjustment, but then in it is also this reference to giving authority to the Director of Emergency Services, which Councilman Penman spoke to. And in the rules and procedures of the Harford County Council, Section 6A, it states that every law except for the budget law and supplementary appropriation laws shall embrace but one subject. And so I was just trying to understand why also included in this fee adjustment bill is also this piece about, the authority given to the Director of Emergency Services.
I mean, my understanding was that it was in the same section and that it needed to be addressed together because it was in the same in the same section of the code. But I'll defer to council attorney, or again that was our under. I mean, that was.
My only concern is if we were to pass, bill number 2313. But then not pass, just hypothetically, not pass Bill 23-15, wouldn't that create an inconsistency in what the code says? Because, added language to 2313 kind of exists under the assumption that 23-15 also passes. And then you would have a code that doesn't align with itself because of it seems like that language in 2313 should either be added to 2315 and be there, or be its own separate bill. But adding it in makes it messy on how it affects the code if we vote yes on one and no on the other.
Yeah, and I think that was why why all these bills were kind of brought together to be able to speak to them all on the same night, is because there was some overlap, which I guess creates some of these logistical issues.
Am I asking the council attorney? Am I right in my understanding of that as far as what?
You mean the one subject for legislation?
Mm-hmm.
Yes, you're right, but if you look at the last line of the bill, it's generally relating to Department of Emergency Services, which is sort of like catch-all. Most bills are written that way. So as long as it's within the ambit of the Department of Emergency Services, then it covers one subject. And this bill does, in fact, cover one subject, although a couple different aspects of that subject.
Okay. Thank you, Mr. Bennett. Mr. Guthrie.
Just a couple of things. Having negotiated a lot of collective bargaining agreements with healthcare, healthcare usually is number one. Every time you get started, try to get straightened out. They're all very common. They're the same thing that you're talking about, is that the employer, the company, the county, whatever, you try the bill as high as you can to make sure you get all the insurance company's going to pay. Not that you're going to charge the person the difference. So if you charge $1,000 and the insurance company pays $900, then you're taking $900. That's how mostly all of them work. I understand that's what we're talking about, right?
Yep, exactly.
Okay. Also, we're talking about arbitration, arbitration is binding, or it wouldn't be arbitration. Mediation is not. That's the difference. Thank you, Mr. President.
Thank you, Mr. Guthrie. Anyone else? The only one thing I'd like to ask, though, I know the volunteers have been billing since when? Have you ever turned anyone away because they couldn't pay a bill?
No, sir. We never sent, my company never sent anyone to collections. We sent two requests for payment on the copay, which Medicare forces us to do, and if not, we write it off. We're still Bel Air Volunteer Fire Company.
I knew that. I just wanted to put that out there. Thank you for that. Ms. Dixon, do we have anyone signed up?
Mr. President, can I just add
Mr. Guthrie.
Just want to add something quick. If you're riding in an ambulance, you ain't going to give a damn what it costs.
Ms. Dixon, do we have anyone signed up?
Chip Riley.
Good evening, sir.
Good evening, Chip Riley again, Park Beach Avenue in Perryman. This bill allows a more suitable and ambulance fee program that is more comparable to other counties in Maryland. I did look, and it does make it very, very comparable. Those fees will go to helping the county EMS system to become more effective and efficient. So I was saying, please support this side of the bill. The other side I have not looked into, and I can't refer to that at this time. So thank you.
Thank you, sir. Anyone else, Ms. Dixon?
No, Mr. President.
With no other speakers, this will conclude the public hearing on Bill 23-013, and we will take it up at a future meeting. Bill 23-015, Amendment to Chapter 28, Fire and Ambulance and Rescue Organization. Again, gentlemen.
Okay, again, we've already discussed a lot of this already, but this section of the bill is adding language to law that states that the Director of the Department of Emergency Services will oversee fire, rescue, and emergency medical services in the county. It also provides language for the Harford County Volunteer Fire and EMS Association to appeal decisions. That's the part that the Volunteer Fire Company, I think, is going to speak about tonight. They want to have the right to put an amendment in to appeal decisions, and I support their effort on that. it does add a section 2 that is language, so kind of requires the county executive to provide funding to the volunteer fire companies on a yearly basis. Right now, it's just, they put their annual budget in, but there's no guarantee that the county executive will provide funding. This law and adding this to the law kind of dictates in a way that the county executive on a yearly basis will provide funding to the volunteer fire companies. And really, the remaining section of the bill is just cleaning up language and defining roles. And that's about it.
Mr. Sales?
No.
Thank you. Counsel, Mr. Penman?
Again, I just want to put it on record, and I appreciate what you just said, that, you are supportive of some sort of arbitration. So, again, just put it on record that I would like to see the county administration as well support an arbitration method inside this bill. So the Fire Association has, some sort of avenue when there's an impasse. Thank you.
Thank you. Anyone else, counsel? Ms. Dixon?
Yes, Mr. President, we have 3. Chip Riley, followed by Tony Poliano.
Good evening, sir. Name and address again, please.
Chip Riley, name's on record, I think, by now, or the address. I agree on the verbiage changes and tidying up the gray areas in the bill. Also, having the director responsible for emergency services coverage is better suited than having each individual fire and EMS company figure out what they're doing at such a difficult coverage shortage time. So please support this bill 23-015. Thank you.
Thank you, sir. Good evening, sir. Name and address, please.
Tony Poliano, 800 Drive, Bel Air, Maryland. I'm lifetime past president of Bel Air Volunteer Fire Company, and I'm also a trustee to the Harford County Volunteer in the Fire and EMS Association. The association was given this bill the last Wednesday of the month in March, and it was submitted to the council the first week of April. So we didn't have a lot of time to look at it, but we were told that we could offer amendments to the bill, which we made a motion to have a third-party arbitrator arbitrate any disputes between the association and Department of Emergency Services. We would fully support the bill with that amendment in it. The trustees have already voted to do that as such. But I want to make this one thing really clear to everybody, the understanding. This is no negativity on the Department of Emergency Services. We've worked under Director Strickland, Director Hopkins, and now Director Ayers with no problems and no issues. Anything that did arise was able to be negotiated or communicated to everybody's liking. Mr. Penman had it right, that we do need that arbitrator in between the exec and the DES. Recruiting and retaining volunteers is important, and that's a fine line we walk sometimes to do that. And of course, fire service is steeped in tradition, and this is a big change for us. Having the Department of Emergency Services have more oversight than they ever had before. But I believe with the current people that are there now, it would not be a problem. But like Mr. Penman said, we don't know what's going to happen down the road, and other counties have had issues that we don't want to see in our county. So I appreciate that gesture on their part to arbitration, and I hope the county council agrees. Thank you.
Thank you, sir.
William Dusa.
Good evening, sir. Name and address, please.
Bill Dusa, 600 River Shore Court, Edgewood, Maryland. I'm the vice president of the Harford County Volunteer Fire and EMS Association. And quickly, all I've got to say is that the association, as Tony said, has voted to support this bill with the amendment that has been submitted to Council President Vincenti. So we're ready to move ahead if we can get the amendment through. Thank you.
Thank you, sir.
There are no more speakers, Mr. President.
With no other speakers, this will conclude the public hearing for Bill 23-015. Mr. Ayers?
I was just told that the amendment was written today, so we can send
I was going to
that.
say, I don't have an amendment yet, so,
And I was told it was written today, so.
yes, that's fine. Just wanted just for the record, I don't have an
I
amendment yet.
didn't have it yet either, but I was told it
But
was.
thank you for clearing that up. Again, this will conclude this public hearing, and it'll be taken up at a future meeting. Thank you,
sir.
gentlemen.
Yep,
Thank you for your service, all of you.
Thank you.
We're going to take a short recess, and we'll be right back. Good evening, Chair. Calls to order Legislative Session Day 23-016. Please join us in standing for the pledge, followed by opening prayer, or the prayer by Councilman Member Bull Sottles. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Heavenly Father, I come to you tonight asking for guidance, wisdom, and support as we begin this meeting. Help us engage in meaningful discussion, allow us to grow closer as a group, and nurture the bonds of community. In Jesus' name, amen.
Amen. Amen. Agenda number 4, presentation and proclamations, we have none. 5, consideration of petitions, applications, appointments, and nominations. Executive appointments, Harford Soil Conservation Board of Supervisors. May I have a motion?
Council President, I move to approve the new appointment of Ruth Castley.
May I have a second?
Second.
Thank you, Mr. Riley. It's moved and seconded to approve Ms. Castley of the Harford Soil Conservation Board of Supervisors. Is there any discussion? Ms. Dixon?
Mr. President,
Aye.
Mr. Guthrie.
Aye.
Mr. Penman.
Aye.
Mr. Giangiordano.
Aye.
Mr. Riley.
Aye.
Mrs. Bosaddles. Aye. Mr. Bennett.
Aye.
Being 7 votes in the affirmative, 0 in the negative, the appointment is hereby approved. Citizens Nursing Home Board of Directors, may I have a motion?
Council President, I move to approve the new appointment of Kathy Vincenti.
May I have a second?
Second.
Thank you, Mr. Riley. It's been moved and seconded to approve the new appointment of Ms. Vincenti to the Citizens Nursing Home Board of Directors. Is there any discussion? If I may, Ms. Vincenti is married to my cousin. She is a lifelong resident of Havre de Grace. Her father was the past mayor of Havre de Grace, Frank Hutchins. He also served on this council for years. I do believe that she is going to be an excellent person for that role on the Board of Directors there, but also I will be abstaining from the vote. Ms. Dixon?
Mr. President,
Abstain.
Mr. Guthrie.
Aye.
Mr. Penman.
Aye.
Mr. Giangiordano.
Aye.
Mr. Riley.
Aye.
Mrs. Bosaddles. Aye. Mr. Bennett.
Aye.
There being 6 votes in the affirmative, 1 abstention, the appointment is hereby approved. Agenda number 6, special presentations, we have none. 7, approval of minutes, Legislative Day 23-015, May 9th, 2023. Fiscal year 24 budget public hearing, May 10th, 2023. Are there any corrections to the minutes? There being no corrections, I'm going to stand approved. 8, introduction and consideration of resolutions, we have none. Mr. Giangiordano, please read Bill 23-025 into the record.
Bill 23-025, moratorium extension, introduced by Council President Vincenti at the request of the County Executive. An act to extend the moratorium adopted by Bill 23-005 for an additional 90 calendar days immediately following the expiration of the moratorium adopted by Bill 23-005, which is a moratorium on the issuance of any approvals or permits for any development of any warehousing and wholesaling, processing, distribution, and local delivery facilities on property zone Village Business District, VB, General Business District, B3, Commercial Industrial District, CI, Light Industrial District, LI, and General Industrial District, GI, in Harford County, so that the Harford County government can study and reconsider its zoning and development regulations with respect to such facilities, all as generally relating to zoning. Public hearing scheduled for Bill 23-025 on June 20th, 2023 at 6 p.m. in these chambers.
Thank you. Agenda number 10, introduction and consideration of amendments, we have none. 11, call for final reading of bills, we have none. 12, enrollment of bills, none. 13, unfinished business, none. 14, new business, Board of Education, Harford County, request for capital transfers. Mr. Brown? Ms. Judd? Ms. Judd.
Good evening, President Vincenti, Vice President Giordano, and council members. We are here to answer any questions that you have on a capital transfer from our fund balance that the Board of Education approved on April 24th. The approximate amount is around $21 million. We can go through the line items if you'd like us to. Again, we're here to answer any questions that you have. I believe you received this last week, Mr. Vincenti, for review, and if you had any questions, you could contact either Mr. Brown or myself. To date, we hadn't had any questions, but we are certainly here to explain or answer any questions.
I think it would be appropriate, because maybe some of my council members have not had a chance to review all of it, if you could go line item, please.
Yes, good evening. Thanks for giving us the opportunity to review our transfer. What we're looking to do is transfer funds of $750,000 to address stormwater management and erosion control over at Joppatown High School. We've had some site issues over at that facility, and while we were moving forward with the renovation of Joppatown, that was some additional work that we noticed during that time. So with funds that we have at the end of the year, we'd like to transfer $750,000 to address that issue. Also, we are looking to do an overlay and maintenance project over at our facilities annex in Hickory. It's $500,000 to repave the parking lot where we have our special ed buses currently parked there, and employee parking. Also at Joppatown High, while we were renovating the facility, in the boiler room, we noticed that we had some water infiltration when we moved forward with the HVAC renovation there. And we had a structural engineer do a evaluation of the wall in the boiler room, and there's a stress crack that needs to be filled and repaired. So we're looking for $150,000 to address that issue. As you know, we have furniture requirements throughout the school district. Each year we ask for, some funds to replace furniture at schools. This year we're asking to transfer money in the amount of $500,000 to address that need. We have a large fleet of, vehicles for facilities, our employees, our food and nutrition workers. We very rarely receive any funding to replace those vehicles. We rely on fund balance to address those replacement needs. We're asking, for $3.5 million to address those needs for our white fleet. Our facilities, grounds department, we have tractors and equipment that we use to maintain our grounds. Again, that's another account we haven't been funded for in the capital budget. We're looking for $600,000 to replace that, equipment. Under our technology budget, total of $10.6 million, $6.5 million for our Oracle implementation, costs where there's some licensing fee, contingency. We have a project manager working with us, and we're looking to include some timekeeping system. Right now, we pretty much are on a paper process for punch cards and recording our payroll and processing our payroll. So we're looking to add that as we upgrade, our ERP system. And we also have some technology requests that we have in our capital budget for device refresh, network switches, power supply for our network closets, some firewall end-of-life warranty requirements, and then some access point refresh that's rolled up into that technology request. There are several life and health and safety compliance requirements that total $2.1 million. That would include fire alarm upgrades at Falston Middle School. We're looking for some access control upgrades. You know, when you come to the school, you have our Prox card swipe at our buildings, so we're looking for you know, system-wide staff badge upgrades through our Office of Safety and Security. We also have underground storage tank at North Harford Elementary School that we like to replace. And then just a small amount of $60,000, considering all that we're asking at Old Post to replace the backflow prevention system at that school. Also, we're looking to take care of some needs at Harford Glen. We have a bridge and a pier that's been in place since, I believe it was 1959. Needs to be replaced. We're asking to, you know, move $500,000 in order to remove the pier and then replace the bridging structure that's currently a wooden structure with, you know, something metal. We have to, you know, engineer that. Aberdeen High School, something was brought to our attention a couple of years ago, where Aberdeen High is the only stadium that doesn't have a ticket booth. So when they go to collect fees, when they come to their football games and things of that sort, they have to set up a table. So we just, you know, like to build, you know, the standard ticket booth that we have at all our high school stadiums. And then we have facilities repair programs where our facilities folks replace or repair folding partitions at our schools, repair bleachers, and then some ADA improvements as they are needed. And we work closely with our special ed department while we work that through. Under our blueprint program, Edgewood Middle School, there's a requirement for community schools for, I think it's a nursing health function at the school facility. So we looked at a couple of rooms that we would like to modify in order to address that community need. And the last time I was here, we were talking about some of our space issues and the need for relocatables. When I first came here, we had like 147 relocatables, and we started to, you know, reduce our inventory. Now with pre-K, community schools, and some other needs, we're starting to see that we have, you know, we don't have enough space in some of our school buildings. So we're starting to evaluate and place, you know, relocatable units where they're needed to address those space issues. You know about the Senate Bill 528, the Climate Solutions Now Act, where the legislature last year wrote a requirement that states that June 1 of next year, school systems, they can't replace their diesel fuel buses. They have to, when they go to replace them, they have to move to EV buses. So we like to do an evaluation to see what that is. So we're asking to, you know, hire a consultant to help us figure that out. We operate 115 special ed buses, and 405 buses are contractor-owned. So under that piece of legislation, all of that's included. So we have to figure that out. So we're asking to move funds for that. And that's pretty much the entire list that, you know, adds up to that $20.6 million. And I don't know if you have any questions.
I don't, but I want to thank you for going through the list, because like I said, I'm not so sure that everyone had an opportunity to go through. I'm going to open it up to council for questions, if anyone has
Mr.
one.
Vincenti, if I could, just one.
Yes.
There's also a request to transfer $1 million to the Talent Pathways Initiative. That was approved last year for some funding, but this would extend that program as well. So I just wanted to make sure that was on the record as well.
And I want to point out that Drew's in the audience too, if we have any questions for anything to do with IT. And council, Mr. Giangiordano.
So my question comes down to the technology question, the Oracle implementation cost, and what, I know Oracle's like a Cadillac, and what other competing systems did you look at, and what were those costs?
We looked at various systems. We looked at replacing the current system, which is Lawson, which is now called N4. We looked at, Cornell and I were on that RFP. We looked for a year and a half, 2 years. Surprisingly, Oracle was the best priced as well as the best product. We thought exactly the same thing that you thought, that we're never going to be able to afford Oracle. It's going to be double the price of everything else, and it really wasn't. We did have some funding allocated for it. This is additional funding we're asking to put there, and you can see the different reasons. Licensing fees, as Cornell said, the timekeeping system, that would be integrated into our payroll system and our documentation system. Project contingency, if we go above and beyond the budget that we have, that's a contingency. Anything that we wouldn't spend of the money, that if you were to approve it, we would come back to the Board of Education in a future year. Let's say there was $1 million left over. We would then propose to use that $1 million on some other type of capital project.
What systems does the county use? Did you look at
County
piggybacking
uses
off on the county?
Workday, Ms. Spence, Workday, we actually talked with them 4 years ago when we first started this process. They got out of the K through 12 sector. They were having a lot of problems implementing.
And the licensing fees, is that a one-time event, or is that an ongoing?
That's an ongoing fee. We do have that built into our operating budget. We pay a licensing fee for our current ERP system now. There's going to be a time period where we're going to be paying that fee to maintain the old system and the new fee. This is kind of a buffer in case we don't have enough in the operating to cover it. The fees are a little bit more for Oracle than our current system, but our current system goes back to implementation between 97 going live in 99, so it's a very archaic system.
Same thing with the timekeeping system, that's going to be an ongoing fee, correct?
The timekeeping system, I believe, would be an implementation fee. There may be some additional costs to run that each year. Cornell's a little bit more familiar because that's really for our facilities.
So the timekeeping, we have to procure it, so we haven't. So this is the budget estimate for the timekeeping system. So we have to put out an RFP and go through that whole selection process. So we're not even there yet, but this gives us the authorization to move forward.
So it doesn't sound like there's a lot of players in this market because of the kindergarten through 12. The issue that you said Payday was one and they don't offer anymore.
Well, Workday,
And
they
yet
don't
Oracle,
do that now. Oracle, Lawson.
We interviewed, shortlisted down to like 3 or 4 companies that actually presented and, submitted their information. So Oracle was the successful vendor after going through that solicitation process.
Okay. Thank you.
Sure.
Thank you, Mr. Giangiordano. Mr. Penman?
I don't necessarily have any questions, just a comment. I just want to thank you guys for the presentation and pass my appreciation off to Dr. Bolson. I had the opportunity to visit all the schools in my district over the last few weeks, to talk to the different administrators and the staff personnel at the schools, just to try to understand the budget and the impact that each school would have. And in that conversation, there was structural issues, capital projects, and a lot of not everything, I can't speak to everything, but there were a few things in the different line items here that, are going to be used to address some of the issues that I was shown at the different schools. So if you could pass on my appreciation for the staff at each of the schools in District B.
Will do. Thank you.
Thank you, Mr. Penman. Mr. Guthrie?
Yeah, I also want to thank you. I think you got a list here that you got to do a lot of work on. I can see. One thing I want to ask you about is, when I was on the council before, I always had a huge problem with this, and we were able to get rid of them, but it looks like maybe we got some more back. The relocatables, are you talking about the ones at the schools?
Yes.
I know we had 90 of them at one time, and that was a lot, and we got, what irritated me, and this is back 2002 to 2012, 14, and what really got me was every time they had to move one from one place to the other, it cost about 30 grand. Am I right there?
It's more than that now.
I know it's more than that now. I mean, that shocked me enough because it's just electric. There's no plumbing to fix up or nothing because then, anyway, none of them had any plumbing fixtures and was having any toilets. You had to go to the main school. The kids had to go to the bathroom. And if they picked up a relocatable and took it from point A to point B, wherever it was, cost over 30 grand. I couldn't believe it, to hook up a trailer to a truck and drive it from point A to point B costs you an enormous amount of money. So what's it cost now?
Just to relocate, like 80 grand now, but you're looking at.
80,000. That's
you're
more
looking
than
at
the damn trailer
ramps.
cost.
You look at, well, not, relocatable now costs like $200,000 if you want
Okay,
to buy
well.
a new one. That's what they're costing. But you're looking at site work, you're looking at decking, that, you know, and the transportation costs, the electrical work. So all of that's permitted, and that's just the going rate. So we actually have to design, pull permits, and bid. We bid it out, and we get the low bidder, and we award, you know, project by project. So these units will address, again, we're talking about buying new, not relocating. We're down to 40-something units now, but now, again, not to be redundant, but to address some of our space issues that we have because the increase in programs, we're looking to purchase a couple of new units to place them to address those needs.
And when we built all those schools back in the 2008, 9, 10, 11, 12, was to try to get rid of all these relocatables because of the cost.
Right, and
You know?
now we're talking, the
So how
schools
many
that
we
we
have
built
in-
were not the elementary schools, so now these units will be placed at elementary schools where we have the pre-K and the community school requirements under the blueprint.
Well, we replaced some we replaced Deerfield, tore it down, built a whole new one.
And we're not talking about placing a unit at Deerfield.
There, okay. But it just seems to me like a tremendous amount of money. But you're saying take it from point A to point B, and you gotta put the service and all this other. But, and what happens, I mean, is that a fixed price, that's what it costs regardless? Because if you take it from point A to point B, and point B had one before, and you're putting it on a slab that's already been there, and all you hook up is electric.
So
right?
We get a engineer, and they lay out, the architects, they lay out what the requirements are. So if there's a pad there, and we've removed pads, once we did remove, you know, the old units there, but they do the design work, and every requirement is based on the school that we're placing a unit. So it's different from site to site.
Okay, so how many do we have in the county now?
It's about 45, 47 units is what we have now.
It's down from 90, but
When I came here, it was more than 90. We were at like 130, 140 when I
when
started in
was that?
2008.
When was that? 2008?
2008.
So it grew before
now-
we start,
no,
well,
yes.
I guess before we start building some of the schools, or
Then we
enlarging the schools,
reduced
I
it,
should say.
and now, again, with the requirements that we, you know, have to meet, we're finding that we have our schools really are, you know, stressed. And when you start looking at our elementary schools, you know, we're at, you know, 93, 95% capacity, you know, throughout the school district. So some of our schools are exceeding our utilization rate. So we do have a space issue that we need to address.
Looking at the APFO, I noticed that, what have we got, maybe one or two schools that are really over the capacity, 110% capacity?
In Bel Air.
In Bel Air. There's only two schools over capacity.
Yeah, we have Bel Air Elementary, and Homestead Wakefield will be addressed with the new school.
It's a lot better than when we had 120%.
Yes.
Remember that?
Yeah, definitely.
Hey, thank you, Mr. President.
Thank you, Mr. Guthrie. Council, we have a little bit of a different process here this year. County Executive has asked us to approve these transfers before the balancers are done with the administration. So may I have a motion?
Council President, I move to approve the requested capital transfers.
May I have a second?
Second.
Thank you, Mr. Penman. It's been moved and seconded to approve the request for capital transfers. Is there any discussion? Ms. Dixon?
Mr. President?
Aye.
Mr. Guthrie?
Aye.
Mr. Penman?
Aye.
Mr. Giangiordano?
Aye.
Mr. Riley?
Aye.
Mrs. Bullsaddles?
Aye.
Mr. Bennett?
Aye.
There being 7 votes in the affirmative, 0 in the negative, the transfers are hereby approved. Thank you, gentlemen.
Thank you.
Thank you.
Executive request for outside counsel, Mr. Blumquist. Good evening, sir.
Good evening, Council President, Vincente, and members of the council. I'm here to request an additional outside counsel to assist the law department with litigation in the police and correctional officer liability area and perhaps in the employment area as well. We have one outside counsel, Rosenberg, Martin, and Greenberg, that was previously approved. I'm looking at this firm based on my past experience with this firm and the extensive experience this firm has, and really the specialization that this firm has with respect to police liability and correctional officer issues. That's been the focus of their practice, along with employment law issues, for over 30 years. They've handled these issues for the local government insurance trust for over 30 years. That's the insurance trust in Maryland that represents a lot of Maryland municipalities, as well as some of the counties, particularly some of the smaller and medium-sized counties. So this firm, really, that's their specialization. Their rates are significantly below the rates of Rosenberg, Martin, and Greenberg, but also I think they'll be an excellent resource. I'm hoping additionally to use them for a few tangential issues, such as policy review for the correctional facility and for the law enforcement operations of the sheriff's office. They've worked on policy with the local government insurance trust and consultants for the local government insurance trust. So I think they bring an expertise that currently the law department doesn't have with respect to policy. From time to time, the sheriff has requested the law department for input on policy changes that are being made for both correctional operations and law enforcement operations. I feel that we'll get a better caliber of input with the assistance of this firm. So I'm requesting approval for this firm because I think they'll help us address a lot of liability issues that are really within their scope of expertise. And again, Kevin Karpinski, for decades, has been the attorney who answers the employment hotline for the local government insurance trust and addresses issues. We do most of that in-house, but I look at that as also a resource because of the amount of employment law litigation they do, and also because of the experience they have with the hotline. They're abreast of all the issues. They stay abreast of all the Supreme Court decisions, the Fourth Circuit decisions, as well as the Maryland decisions affecting employment law. They study all the bills that come through both the General Assembly and at the federal level, making changes to employment law or when the different agencies update employment regulations, they're on top of that. And so I would look to use them too to make sure that we don't fall flat on making adjustments to our policies and procedures with respect to employment issues as we move forward.
Thank you for recognizing that there is a need for outside counsel. That there are times that in-house is not have the expertise to handle some of these cases. So I'm glad to hear you recognize that. I'm glad to hear the county executive recognize that. I was concerned early on when he said he was going to try to do everything in-house. It's almost impossible. I'm not saying it can't be someday, but out of the gate.
And part of it's a question of numbers and what's the most efficient use of in-house versus out-of-house, and we're trying to strike the right balance.
Yep, I appreciate it. Counsel, Mr. Penman.
Mr. Bloomquist, thank you. As I've mentioned before, I am supportive of subject matter experts being involved in issues that relate to law enforcement and corrections. There was a little bit of a different spin on it, though, when you spoke about it, about the review of the policy and the procedures. Now, I know we have some victim advocates, attorneys that work for the sheriff's office that work at the victim advocate role, as well as a review team for policy and procedures. Would this outside firm or you be working with those two attorneys named Melissa Lambert and Chris DeBone?
Have been working with them. Will continue to work with them. What happens is they have sent over policies. They've sent over 3 policies since I've been, 2 correctional officer policies and 1 law enforcement officer policy, asking for our input on those issues since I've taken the seat as county attorney in December. And I said quite candidly, look, I can help. I can give you my thoughts, but I don't know that my thoughts are going to be a lot more advanced than the thoughts that you've already gotten from your in-house people. I look at this firm as a resource. This is what they do. They live it day in and day out. They're working the cases day in and day out. And they've also worked with the local government insurance trust, which has retained from time to time, outside experts in terms of law enforcement policy and law enforcement policy updates. They used to assist John Breeds, who used to write the roll call reporter for the local government insurance trust before he retired, and that was kind of a monthly publication that he put out with new cases from the Supreme Court or the Fourth Circuit or the Maryland State Appellate Courts with decisions that impacted criminal law and criminal procedure and would talk about policy and adjustments that law enforcement officers had to consider making in terms of their past practices and procedures because of those legal changes. So that's what they do. And I'd rather have that kind of advice. I mean, that's cutting edge, that keeps us current. And I think you recognize how important that is, because the officers on the street need to know if they need to adjust their practices and procedures because of changes in the governing law.
You're exactly right. The law enforcement's always evolving, whether it's through case law or legislation. And it sounds like the two attorneys that they have in place have a vital role on making sure, at least to send over those 3 policies that you mentioned for further review. It was just a concern to me because in the budget, those 2 attorneys were zeroed out on salary as if it wasn't needed. So,
well, that's not my decision. I work with whoever's available. Our objective is to provide the best advice and counsel we can for the agencies, and certainly the sheriff's office is a responsibility for us in terms of the liability and the policy and practices issues, and we try to work cooperatively with the sheriff and his staff in addressing those issues.
well, I appreciate that, sir. Then one other question. It says the sheriff's office and then employment law, but that's employment law for the entire county, not
No,
necessarily.
that's the employment law for the entire county. He has his own human resources department, and he's been very gracious as we get up with as we advance our risk management department, because we do handle supervisor incident reports for the sheriff's office, and he has expressed his willingness to work with our risk management as we improve to implement recommendations on training that may be a benefit. They'd have to approve it, but he's the sheriff has been very supportive of working with us, as have the other county agencies, as we improve our risk management and our ability to train and retrain to keep officers and to keep employees current with good best practices.
That's great to hear. Thank you, sir.
Thank you, Mr. Penman. Anyone else? Council, due to the nature of this timing of this request also, it will be handled tonight, so Mr. Penman may I have a motion.
Council President, I make a motion to approve the hiring of outside counsel by the county to serve as litigation counsel and secondary counsel on legal matters pertinent to the sheriff's office and employment law.
Thank you. May I have a second?
Second.
Thank you, Mr. Guthrie. It's been moved and seconded to approve request for outside counsel. Any other discussion? Ms. Dixon?
Mr. President?
Aye.
Mr. Guthrie?
Aye.
Mr. Penman?
Aye.
Mr. Giangiordano?
Aye.
Mr. Riley?
Aye.
Mrs. Bull Saddles?
Aye.
Mr. Bennett?
Aye.
There being 7 votes in the affirmative, 0 in the negative, the request for outside counsel is hereby approved. Thank you. Mr. Kearney, with your question earlier, Mr. Giangiordano is going to go back and repeat the public hearing time for Bill 23-025, just to be sure for the
So-
record.
Thank you.
Bill 23-025, moratorium extension. The public hearing schedule for the bill will be on June 20th, 2023 at 6:30 PM in these chambers.
Thank you. Agenda number 17, comments and input from attending citizens. Ms. Dixon, do we have anyone signed up?
We do, Mr. President. We have 3 this evening. John Malamo, followed by Ron Stuchinski.
Good evening, sir. Name and address, please.
Sir, good evening to you and your colleagues. John P. Malamo, 2402 Eagleview Drive, Bel Air, Maryland. At the DAC hearing, I asked these questions and got the answers from the DAC chairman, Mr. Milton Davenport, now Deputy Director, Department of Planning and Zoning. From the transcript, question to the DAC chairman, who would address the project operating in the fourth dimension, time and altitude? He noted that comments were provided concerning the surface conditions of the airport, was concerned about the overhead traffic conditions as well. Answer, MAA and FAA would dictate what airports can do and cannot do as far as operations. Question, would county be using zoning powers? Answer, zoning issue has been addressed by the Board of Appeals. Operation and expansion of the airport was obligated to go to the Board of Appeals for a special exception. Statement, this was not an operational park, was still in the zoning and planning process. He said the project will construct a new airport into an agricultural and rural residential area. Answer, explained again how the project was obligated to go to the Board of Appeals. The DAC committee must ensure that the project complies with the conditions of the Board of Appeals case as determined by the hearing examiner and the county council as indicated in the review comments. Question, how much jet fuel would be stored on the site? Answer, from Airport Owners Group representative, he did not know and it was an operation question. Question, how much jet fuel would be present? Answer, uncertain, and added that it would be regulated by the Department of Environment. Maryland Department of Environment. Mr. Malamo asked about the traffic pattern associated with the airport. Answer, the runway pattern was on the site plan and the air traffic was regulated by the Maryland Aviation Administration. He was not aware of the traffic pattern. Mr. Malamo stated that was a fourth dimension. He confirmed that the county was to uphold the case as determined by the Board of Appeals. One of the conditions was that no more than 50% of the operation could be in the ag zone, and none of it could be in the rural residential zone. He asked if the plan showed where the rural residential area starts. Answer, there was no rural residential zoning on the property. Mr. Malamo demonstrated the traffic pattern for the proposed plan going around and parallel to the runway. He asked at what point in the pattern an airplane begins its descent for landing. Mr. Davenport responded. He was not an expert on aviation, was not able to answer questions about aviation. Question, is the traffic pattern part of the airport? It is certainly part of the takeoff and landing. Answer, assume that there were patterns that the airport must comply with regarding the MAA and the FAA. Statement, the pattern was established by the project, not the FAA or the MAA. He said it was a zoning issue decided at the local level. Mr. Davenport said he expected that the hearing examiner and the county council reviewed that as part of the cases, adding that if Mr. Malamo disagreed, he had the right to appeal the decision to the circuit court. Good night.
With the introduction of the moratorium extension bill, I'm going to reserve my comments for tonight. Thank you.
Thank you, sir.
Kate McDonald.
Good evening, ma'am. Name and address, please.
Kate McDonald, 2100 Park Beach Drive. Good evening. It's a fact that air pollution disproportionately affects marginalized populations of lower socioeconomic status and communities of color. But that isn't because people of color or poor people are innately more susceptible to chronic health conditions. It's because community leaders have enacted and perpetuated discriminatory zoning policies and procedures that concentrate undesirable and toxic developments into these marginalized communities, and those leaders who failed to act for change. These communities like Perryman are also underserved with poor infrastructure, with little or no taxpayer money going to revitalization or general upkeep of streets, sidewalks, not that we have any, parks, etc. No effort or thought given to updating environmental and water quality studies prior to allowing additional industrial development. This is what we've been telling you for the last 18 months. It doesn't matter who's up here calling you out. The bottom line is that you're still violating human rights by continuing to allow Perryman to be bombarded with toxic and dangerous diesel truck traffic and mega warehouses. Last year, the Maryland General Assembly was successful in passing the Climate Solutions Act Now Act, which sets more aggressive goals for the reduction of greenhouse gases with a 60% reduction by 2045 and establishes policies to achieve those goals. Another very important aspect of the bill and relevant here is its investment in climate justice. It directs the Maryland Department of Environment to work in consultation with the Maryland Commission on Environmental Justice and Sustainable Communities to study cumulative impacts and establish strategies to address environmental justice and advance climate equity. The policy also defines the term overburdened communities and underserved communities, using metrics identified through extensive research and consensus work. We know that Perryman alone already fits into the description of an overburdened community, given its size, socioeconomic, and ethnic makeup, and that's with the current level of industrialization. Add to the fact that Harford County has allowed nearly 100% of the industrial development to be constructed in communities south of I-95, where nearly 100% of the county's minority and low-income residents reside. It's very clear to all what the agenda has been for years. We will be working closely with these agencies to continue to expose what's been happening in Perryman, the hands of Harford County, and help fight off future developments and work towards restitution and remediation for Perryman. Access to a healthy and healthful environment is a birthright of all citizens, not those that can afford to live in your area or above I-95. Thank you and good night.
Good night.
There are no more speakers, Mr. President.
We'll move to agenda number 16, business from council members. Mr. Bennett.
Hello. First, I just wanted to address, we did not move on any sort of zoning bills tonight or introduce any zoning bills tonight. That was something that I was not expecting when I looked at my calendar for the month of May. But as we continue to work to make sure that something comes forward that can pass, something that can be accepted by all, and something that can be of a high-quality bill when it's going to be of a permanent impact to helping our community. I wanted to make sure that at the very least we extended the moratorium and work towards that so that we have the time to do the adjustments we need to do to strengthen the bill, to get our fiscal analysis that's needed, to do those things so that come the fall time in September when we come back from recess, something can be introduced that will ensure that all communities are taken care of, all stakeholders are taken care of, and that the best interest of our community is in mind, and that we have a package that everybody can swallow and feel comfortable with. So I just wanted to address that because I'm sure there's plenty of people in the room who were thinking they'd be coming here to hear about a different bill being introduced tonight. Along those same lines, I've had a few people reach out to me about the warehouse work being done on Woodley Road right now. That was something that I was confused about as well when I saw that happening. So Heather and I reached out to Shane Grimm, who explained to us that work was approved prior to the moratorium taking effect, and the building permits and all that were there in place. So that's the information we got from Shane Grimm on what's going on Woodley Road right now. And along those different lines, moving along, next weekend, Saturday, May 20th, is Armed Forces Day. So on Aberdeen Proving Ground, they're going to have a demonstration day from 11 to 4 with exhibits and demonstrations. And it's all going to be totally free to the public. So that's something to take advantage of, to learn about our armed forces, celebrate our armed forces. This past weekend, there isn't a whole lot to report on what I was doing in the district for once. My wife turned 30 on Sunday, and so we went to the beach and had a good time. I asked her if she had any bucket list items while still 29. I thought maybe she'd say laser tag or something. But no, we just hung out and walked, and for like the first time in months, talked about something other than the work we're doing here. So it was nice to be able to do that and spend time together and be a couple and not coworkers for 2 days. But so I just want to share all that, and I hope you guys have a good night. Thank you for being here.
Thank you, Mr. Bennett. Ms. Saddles.
Thank you. I'm going to reserve my comments for this evening.
Thank you, Ms. Saddles. Mr. Riley.
Just a couple of things, Mr. President. First off, appreciate the governor coming up in here, and we got to tour the Harford County Department of Emergency Service Center. Also, we had open house at Cairns and Associates over in Bell Camp. And then today I had the privilege of touring Vory Williams Elementary School. I want to thank the principal, Rose Marie, and all the teachers that came out in droves to really show me what's going on in at least our elementary school there, and very much appreciated. Thank you, Mr. President.
Thank you, Mr. Riley. Mr. Jangiordano?
Thank you, Council President. I'd like to congratulate Harford Community College, national champs lacrosse, undefeated season. Their coach, Aaron Verratti. The first time that the national championship was played at Harford Community College, and they beat the two-time national champs, Nassau, who had won 24 championships. So there's not a lot of people that win national championships in lacrosse. And actually, Mr. Bloomquist, who's in the audience here, was the member of Johns Hopkins when they won 2 national championships. So I think three, excuse me, I'm wrong. I stand corrected on that. So congratulations to Harford Community College on their national championship. And then myself and Council President Vincenti and Councilman Penman were at the Red Pump Elementary, their Patriot program. I think they had over 600 kids, and just what an amazing amount of energy. The kids did a great job. It was good to be back. First time been back at a Patriot program in probably 3 years, so very glad to attend that, and I had a great time. And then last but not least, if you haven't looked, but the price of eggs have dropped dramatically. An 18-count carton of eggs is $1.99 at Harvest Fair, and ShopRite it's $2.79. So anybody who wants to grow chickens in their backyard, you might want to reconsider that.
We can vote against the chickens.
Mr. Penman?
Thank you, Tony.
Can't touch that one.
Based on a complete budget review, myself and Citizen Budget Advisor Brooke Searcher have completed a thorough budget review and analysis report. I will soon be releasing that budget summary, which will include key observations of the budget, suggested changes, along with possible budget reallocations that the county executive has the authority to make to fund the necessary departments without a tax increase, as well as possible amendments that the council has the authority to submit to ensure proper funding of essential services, all while remaining fiscally responsible with, again, no tax increases. I have requested an audience with the county executive to discuss the budget review, and hopefully we can begin a productive dialogue. In addition, I will be initiating a dedicated Facebook page for District B under Councilman Aaron Penman, Harford County Council District B, which will provide routine newsletters, updates to the council and district. So please stay tuned. That's all I have, Mr. President.
Thank you, Mr. Penman. Mr. Guthrie?
Thank you, Mr. President. I want to congratulate Dante Banks. If anybody don't recognize that name, he graduated from Edgewood High 4 or 5 years ago as an outstanding football player, and went to college and became even better. And lo and behold, in this last draft, he was drafted by the New York Giants football team, first-round draft choice. First time in Harford County history any ball player had been drafted first-round draft choice, in the NFL. I don't know where the Ravens were when he got drafted, but they were too busy drafting a guy that was 5'9", who's going to catch passes against defenders that are 6'1", and that's going to be interesting to see that. What a wasted draft choice that was. I also went to attend with Pat Vicente. We both attended the Maryland Golf and Country Club recently. Route 40 Business Association had a event there, and Dr. Teresa Fielder, president of Harford Community College, was there. I always like to listen to her anyway. She's a very good speaker. I stopped at Mariner Point Park in Joppatown last week to thank the county employees from Parks and Rec workday, because the director, Paul Magus, was there, also Terry Hanley, deputy director, and they were in work clothes as well as all their people, and they cleaned up the entire Mariner Point Park, stem to stern. So they did a great job, and I really appreciate the effort. And I also told him, look, I can bring a lot of volunteers over to help you out, and he said, no, we want no volunteers from the area. We want to handle it all ourselves. So they did, and they did a great job. Also, on May 11th, I attended the 16th Annual Senior Capstone Expo in Joppatown High School, where they graduated the Homeland Security Emergency Preparedness Program of 25 graduates. When we go to these different things and we see all the youth that are graduating and how good they are and how impressive they are. It really makes you have a good feeling. Also, of the graduates, Sam's sister was one of the graduates, Stacy Harris. She also graduated from there. I will be presenting them with the councilman citation at an event next week for each one of the graduates. Also, I along with Tony and Pat and Jim, we all attended at the tour of the emergency services, and where Governor Westmore was a guest of ours, we had an opportunity to talk to him for a while. And I said, look, we got to fix the roads on Route 40. I don't know if that's going to help any. I guess last week, nobody mentioned it, but from May 8th to 12th was Teacher Appreciation Week. So we want to thank all the teachers in our county. They do an excellent job, and you know, for the future of our county depends on them. Saturday was my mother-in-law's birthday. She was 97 years old Saturday, and she had a great Mother's Day. Unfortunately, Monday, she had a stroke, and she's in the hospital. And probably if it wasn't going okay, I wouldn't be here tonight because we were in the hospital almost all night last night with her. But she's doing very well, and I thank all the people who gave me the many good wishes for her recovery. So with that, President, I'm done.
Thank you, Mr. Guthrie, and we all sending our best wishes to your mother-in-law.
Thank you.
Adequate Public Facilities Advisory Board meeting Wednesday, June 21st, 2023 at 4:30 p.m., second floor, County Council Conference Room. Needed to get that out of the way for the first time. You talked about events, or everyone's been talking about events and Patriot Program, no doubt. Red Pump was amazing. Tomorrow we'll be attending Meadowvale, Thursday, Churchville Elementary, Friday, Darlington Elementary, and then I had the great pleasure of attending Darlington Spring Concert, where my youngest grandson, Jake, was part of the chorus and the band, and it was entertaining to say the least. We talked about, everyone mentioned different events. I do want to mention the fact that Councilman Penman and I attended the Falston Volunteer Fire Company's awards banquet. Chief Scott Blankenship and President Chris Gibbons did an outstanding job pulling everything together, along with Susan's help. And Mr. Tom Shack was the MC, always did a great job. But we want to extend another congratulations to Bill Caliani. Bob Caliani did an outstanding job working tirelessly for years at Falston Volunteer Fire Company. And as a result of that, he received the Chiefs Award. He's with us here this evening, and well-deserved, sir.
Thank you. It's been my honor to serve the citizens of Harford County.
Yes. And then finally, I just want to comment briefly on the efforts, the work that everyone has done over the past months, if you will, but recently in the last few weeks in reference to the zoning bill that was sent over by the county executive. We had several things, several challenges that we need to look at. I was really pleased to be able to sit with the county executive on Monday and listen to the conversations and the meetings that he's had with all the different entities that are involved there. We've done the same thing. My office has done the same thing here at the council building. We've met with 3P, we've met with Chesapeake, we've met with the Mitchell family, trying to find a path forward that everyone can live with, whatever that is. I do believe that that's the right route, and look forward to some solution there that serves the best interests of our citizens. And with that, I will call this meeting to adjournment. Thank you.